The meeting of the Amherst Finance Committee will come to order. It is now Thursday, January 18th, and it is 7:06. Okay. Tonight's agenda will be community services. We will do public health and social services, senior center, veterans affairs, and leisure services. So tonight we have Julie, and she's going to explain and talk with us about public health and social services. Do you know everyone at the table?
I believe I do, yes. Well,
Tim.
just Tim.
Okay.
That's right.
Julie Fetterman, our director of, you have a number of titles, right?
Director of Public Health. Yes, I'm no longer Health and Community Services Director.
Okay.
I went back to being Health Director.
Do we have somebody that is a community services director?
We do not.
Oh, okay.
Yes.
That's fine.
Yeah.
I'm taking the minutes. So officially, are you the health director or the director of public health?
Health Director.
Okay.
Okay.
That's good.
So we have the budget.
We will
Our
have
new
that.
review.
Yeah.
And if you would like to present an overview of public health, that would be very helpful.
Okay. So our public health department has changed over the past few years, and what we did 2 years ago is have the health inspectors move over to inspection services. So we've talked about that before. Then about 18 months ago, we had left the full-time administrative assistant in the health department, and after doing that for about a year, realized that there really wasn't a need for a full-time assistant. The thought was possibly to go to a half-time, but that was complex in terms of personnel, so the full-time administrative assistant moved over to inspection services. So the staff in our department is a public health nurse, Jennifer Brown. She's 24 hours a week. And then myself as health director at 30 hours a week. So I previously, for 2+ years, was health and community services director. Because of changes in my own life, I discussed with the town manager the possibility of working less hours for the town. And so that's when I went last July 1st to 30 hours a week as just health director. So as mentioned before, we now don't have a community services director.
Okay. I'm sorry, how many hours did you say the public health nurse has? 20?
She is, I'm sorry, she's 20 hours a week, not 20. Sorry, my mistake, 20 hours.
Okay, thank you.
Yeah. So during these last transitions, a few of the things that our department was still overseeing, for instance, working with the livestock regulations and the animal control officer, those duties went over to inspection services. So our department now oversees communicable and infectious disease. We oversee tuberculosis. We manage a vaccine clinic, which is for childhood vaccines, and then we also have our flu clinics, which are for town and school employees, and then we do outreach to folks who traditionally don't get immunized for influenza. It used to be that vaccinating the elders was part of health departments, but now that we've seen those rates go up so high and so many people go to their physicians or to CVS and other venues to get their flu shot, the focus is on immunizing those who traditionally don't get immunized for the flu. We also look at regional issues that are happening that are also happening in Amherst. So for instance, we're looking at the opioid epidemic as it continues to grow in Massachusetts and across the country. So partnering with the Hampshire Hope Coalition, which is looking at ways to stem opioid use. We're also closely involved in the ramifications for legalization of marijuana. we have an internal town working group, and the Board of Health is closely monitoring what their role might be with having adult use establishments in Amherst, which will happen starting July 1st. We also work closely with the development of the John Musante Community Health Center, which are hoping will be opening in March. We've got walls that are painted and counters are in, and this has been a really exciting project that will impact a lot of folks in the region and in Amherst. I'm going to take a look at what I've highlighted here. We also continue with the Board of Health to oversee the Hitchcock Center and the Kearns Center living buildings. Those two buildings will always need oversight and monitoring because they each represent an independent water district. So because of the fact that they harvest their own water and are a closed system, they have to hire and they are sharing a water director. But all of those reports and everything that happens there has to be overseen by the Board of Health. So we're very lucky on our board to have two engineers who are both hydrogeologists. Who knew? And so they have a deep understanding of water. And this is something that is still ongoing. They're still tweaking the systems to become completely self-sufficient.
So is this person that we now use, did we have to hire that person
No.
because of these two projects, or
No,
pay
what
for part of
happens
that
is-
person?
No, the Board of Health had to closely oversee the plans for the development of these two living buildings, and but the part of the requirement for each of them from the State Department of Environmental Protection is that they hire a certified water operator. So they're sharing one operator for these two different buildings, but the reports from that operator come to the Board of Health. So the Board of Health doesn't get paid anything to oversee these two buildings. But we're just lucky that we have two people on our Board of Health who have deep understanding of a water system, because as you know, on a Board of Health you have various types of expertise. And one of the people on our Board of Health is actually really a national expert in drinking water. And so the depth of their understanding of what we're overseeing is fantastic. And to give you kind of a reference, when these two living buildings were being built, essentially at the same time, there were only 12 in the whole country, and we have 2 in our town. So it's really sort of a unique and special thing that's happening here that does require a lot of oversight.
But if we didn't have these people,
On the Board of Health.
right, who would be responsible?
The Board of Health is responsible.
And there's no way, as part of, let's just, if they didn't, there was no way as they built that the town could say you will be charged an annual fee for overseeing that water supply as part of the approval for that project.
Yeah, I mean, it's an interesting question. And I always bring this up, that this is such a role that the Board of Health has, because it is rather unique to have taken that on, not just with one entity, but with 2. And I'll say that in the beginning, when this process was started of having the plans come before the Board of Health and the permitting happen on this town side, it was all a very new thing.
Mm-hmm.
And I don't think that anyone thought at the time about having a particular health license or fee associated with that. In my mind, it's prominently clear to me that I would always want someone on the board who had this background. it hadn't occurred to me to look at it in a different way, but that's something that I'll bring back to the board to talk about.
I don't
Just to
mean
think
you
about.
should, no, I don't mean we should hire someone when we have two people.
Yeah,
But when the
but
day
over time,
comes,
yeah,
it would seem to me that part of the approval would say, so long as you have people qualified on the Board of Health, that's fine, but when that no longer exists, then you will be charged a fee to have such a building. Janice?
Yeah, so I was wondering, with regard to that, is there like an inspection fee or some kind of a needed inspection along the way for these buildings?
that's a good question also. There were a lot of inspections done as the building itself and the structures, for instance, to harvest the rainwater, to create a system for disposal, were being created. But we also, because in order to have this, what's called at the DEP level is called a pilot drinking water system. DEP actually had to be very involved and came out to do the inspections. We had one of our local inspectors be at those inspections, but one of the things that I made really clear to DEP was because we had no experience in these type of systems, that to have local inspectors signing off or approving them didn't make a lot of sense to me because they had nothing to compare to. It's all sort of a created thing. So that responsibility was held by DEP, while at the same time, again, one of our board members made himself available to oversee that to a certain extent because he brought knowledge that you could argue that even DEP necessarily didn't have, because he's been so much part of building water infrastructures even in other parts of the world. So he was able to understand at a really great level and ask questions. So again, we were in some ways lucky in that way. But I think, has been a concern of mine how over time we will monitor those water systems. So I think you bring up a good point.
Well, one of the things that I would add to that is that you pointed out that there are few systems across the country like this.
Yeah.
And other communities may look at Amherst for how we're doing it, and we can say, well, we have two professionals happen to be on the Board of Health, but it might be wise to develop something that we could share with communities who aren't as fortunate to have professionals there and say, if we did not have these folks, this is how we would pay for inspecting and regulating, etc. I would like to hear at some point if you've come up with something.
Yeah.
No, I don't have any questions.
Okay.
Sorry, I'm just listening.
Sharon? You're all set?
Yeah.
Okay. Okay, Julie?
Yeah, so I don't know. So when I think about financial impacts, we no longer do any licensing or fees out of my department. So there isn't a whole lot to talk about in terms of that.
I do have a question related to that.
Yes.
Not necessarily about the two living buildings, and that is, we've heard a lot on the news about the lack of immunizations and measles outbreaks, et cetera, et cetera, et cetera. How are we in this town? Do we have pretty good compliance?
Yes,
with,
we do very well in this town, and that's a great question because we've worked closely with the schools since 1998, and we have we get childhood vaccines, which many health departments don't do, and once a month we offer those vaccines to folks who are not getting immunized because they're uninsured or underinsured. So they've got insurance, but those co-pays are really hard to pay to get all the immunizations they need. And the schools work closely with us in terms of when they get a new family who comes to this, who may have come here from a different country or comes here from another state and doesn't have insurance and is going to have to wait to get a doctor's appointment, to get insurance, to get the vaccines, and that means they can't get into school. They call us, we make an appointment, we get that child vaccinated, referred for health insurance and for a medical home where they can continue with their immunizations, and then we get them into school quickly. Again, since, let's see, we started the clinic in '98, probably since about 2000, the year 2000, the schools have had an exclusion date, which they hadn't had before that. So it gives the nurses August, September, part of October to go through all the records and see who is behind in their immunizations. And then they refer them to our clinic and to their own doctors, and everyone gets immunized, and so the immunization rate is really high for Amherst. Yeah.
Okay.
So I would say that just about does it for the health department. I could talk to you now about community services.
Okay.
Social services.
So we do have a list of the committees,
Mm-hmm.
and just to refresh us, which ones do you work with? Town committees?
Which town committees do I work with in general?
Yes. There's liaison from different departments to committees. I just wondered
Oh, just
which
in general.
ones
Okay. So
that your department works with.
yes. So we work with the CDBG committee, Community Development Block Grant Committee. We have an internal marijuana working group that is several different departments plus 2 select board members. I'm part of that. Let's see, any other boards or committees within town? I would say that's it.
Okay.
Board of Health.
Board of Health, yes, sorry, I just came from my Board of Health meeting. Yes, the Board of Health.
Sheltering committee?
Oh, yes. I'm not part of the sheltering committee.
The sheltering committee?
The shelter, yeah, we have a housing committee now. I'm not part of that, but I actually have a working group that brings together police, senior services, and then many other outside agencies, which is our homelessness systems and providers meeting, and that meets once a month.
Is that part of public health?
That is part of public health. Yes.
Because I think this this would be important now to begin putting that in our town meeting report. That
Yes.
isn't always, we do have a list of committees and there's liaisons and so forth, but I think it might be nice to point out under each department, that takes time. Even if
Yeah.
it meets once a month, it's still
Oh, yeah,
preparing
it
and
takes time.
getting information people want.
Right, and it's also, I think it's very effective when departments work together on an issue. So for instance, I guess another one is we have an elder at risk group. So that's public health, senior center, and then sometimes it could bring in the police if needed, it could bring in fire if needed. So we do have different ways in which we work in a multidisciplinary manner that really, I think is very effective, and also does take time.
Okay, thank you. So now, any questions to finalize public health? Janice?
Looking at the numbers,
Mm-hmm.
I was kind of surprised to see, I know that employee benefits is really someone else, but it's almost $96,000 for 2 part-time people. I thought that was a lot, considering the salaries or the personnel services was $111,000. So is that right?
You're talking about the benefits?
Yeah.
Employee benefits?
Employee benefits.
Yeah, the benefits line.
We have
Supplemental
in the
information.
town manager's budget,
Yeah.
Right here.
So you're talking about the 95,701? 95,709?
Yeah. Seemed like a lot to me. Oh,
I see.
believe it includes retirement, OPEB. But I pulled it out last year and brought it to the committee. I'll have Maria pull up that spreadsheet and give it to you guys again.
Okay.
Just double check the numbers.
Okay. All right. Any other questions on public health? Okay, then on to, you're doing social services.
Correct.
And that is 106.
So I did not bring that page with me. I just want to see what we start with.
Here, you want this too? I got an extra close just in case.
Thank you.
Sorry.
Thank you. 107.
Yeah, in that section. Here?
106.
Oh,
Oh, I see. 106. Okay. I just want to make sure I'm going in the right order. All right, so so there are essentially two pots of money that I think I'll be talking about today. I'll be talking about the $20,000 that's appropriated for the emergency assistance program, and then the $60,000 that's been appropriated for general social services. So the emergency assistance program has existed since 2013. Right, so if we look at fiscal year FY18, so that would mean we're about halfway through the year now. We've served 28 Amherst residents, and what we do is we pay landlords or utility companies if someone is behind in their rent and is being threatened with eviction, or if someone is so far behind in their utility costs that they're at risk of having their heat or electricity cut off. The average grant amount that we've given people is $335. 23 people have gotten rent or security deposit assistance, or I shouldn't say security deposit, I should say first rent move-in fee. Because another thing that happens for people is to come up with first, last, and security deposit to move in. Suppose you've gotten a Section 8 voucher. The actual monthly rent may be affordable, but those move-in costs can be insurmountable. If someone can't come up with that money in time, they lose their ability to move into Section 8 housing. 8 people have received assistance with utility bills, and so far we've spent $9,387. So we're on target. What we try to do is we have certain minimal amounts that we help people with, unless there's some extraordinary circumstance, and then we might increase that a little bit. We try to spread it around so that we can help as many people as possible. We could certainly spend it all in minutes if we didn't do it that way. So are there any questions about the emergency assistance and how it
That's
functions?
more, it's a tax line, it comes from tax funds, and it's an account that you draw down off of, and then it comes out of those funds, right, for expenditure.
Correct.
And there's no FTEs assigned to that. You're overseeing it in your role. Is that how it works?
Correct, and that's a very good question too. So we have a very highly qualified volunteer who works in our department a couple of days a week, and she greatly assists with this program because this is something that takes a lot of time. Because a lot of information has to be gathered, you have to work with the person, and a big piece of what we do is, again, much like with our immunization program, we try to link people with supports and with various other programs that can help them stretch their dollars throughout the month, help them maybe with getting employment or education, or linking them with agencies that will be able to help them over time, because this is a one-time thing to help get someone out of a really difficult spot, but often they're in that spot because of a lot of different things that are going on for them. So yeah, so it's this volunteer that really helps with this because there is no staff attached to this. This program used to be located in the planning department, and I believe there was some piece of CDBG money that was helping to pay for an administrative assistant, and so the CDBG programs and the emergency assistance program were sort of, a lot of the on the ground work was done by this administrative assistant. But that money is it's not
How are
really
the
there
people
anymore.
identified?
They
Do you find them,
self-identify.
they self-identify?
They self-identify. All the social agencies know that we do this program, and people hear about it.
Janice?
So can anyone apply, like any resident of Amherst apply?
Any
Or do you have
Amherst
to be,
resident
like
can.
a rector or some sort?
You have to meet certain income qualifications, and I can't remember what percentage we use, but we take it from the state, and it gets adjusted every year as what income guidelines are, and they're the same income guidelines that are used for, I believe, for Section 8 housing. And I should say the other group that gets help with this, and actually that's not accounted for in this statistic, is if there is someone who's homeless and they have a family member somewhere who's in-state or out-of-state who's willing to take them in and they want to relocate with them, we will pay for a one-way bus pass. So maybe that was last year, we had one person like that. But most recently, just a couple of weeks ago, we did have someone who's been homeless for several years now, and we were able to help pay their small rent for the first month to get into housing. So that was a really exciting thing too. So we do use this funds to help folks who aren't housed yet either. So the other funding is the $60,000 that got voted by town meeting into the community services budget to be used for social services. That money, the select board on the floor of town meeting announced that they would have a process that the community could be part of. So in September we had an open select board meeting where people could come and talk about what they thought the need was in the town. Many people came and spoke. At the same time, town staff, including myself, were looking at what we felt were big needs in town. And 3 issues were identified, and the town manager, myself, assistant town manager, and a couple of the select board have met multiple times on this. And just at the point where a decision had been reached about putting this out for a social service agency to apply for, we learned some things from our new procurement officer about how we are supposed to do this. So next week, we anticipate a bid for services to go out, and we will be looking for three bids, and the process is such that we choose the lowest bidder that can meet the minimal qualifications, and this will be to do outreach to the Latino community in Amherst around food access. So linking people with the programs that exist, SNAP, WIC, food pantries, HIP, which is a new program of SNAP, which is quite complicated and which people often need instruction on how to utilize, but which can actually increase your SNAP benefit by 33%. And so what we found in Amherst is that we don't have enough translation, we don't have enough culturally appropriate outreach to folks to bring them into what are a number of robust food programs in Amherst. So what we will do is sign a contract with an entity hopefully in mid-February, and then look at that happening over a 10 to 12 month period of time will encumber the contract. So Sonia can jump in and help me if I've used wrong language in describing that.
No, you did right.
Okay.
So that's one, there's two more.
I have a budget question, and that was for this fiscal 18 year.
Right.
Correct.
And then beginning next fiscal year, according to the manager's report, the same functions will be funded not through the special one-time town meeting allocation, but rather through the CDBG grant.
We're not sure.
Right? I mean, that's the way it was presented in the budget.
Was it?
Page 107. So the budget this year is only to show the $20,000 emergency assistance program, and the $60,000 is assumed to come from CDBG or grant monies.
Oh, I see it's down here.
So I guess part of my question was, A, is that your understanding, and B, that doesn't mean the program will cease, it rather means the funding source is changing. Is that right?
I don't think that, yeah, it says something right there, but I don't actually think that is what the town manager intends. I think that what he intends is that the $60,000 was a one-time appropriation.
Right.
And so the $20,000 has been recurring
I
now
understand.
for several years.
Sorry.
No, go ahead.
The reference to CDBG funding is meant for the emergency funding.
Yeah.
It's something
Yeah.
Oh, okay. So town
they
meeting
have
is going to
time-
read this, and they're going to say, well, we gave 60, let's give 60,000 again.
Yeah, Well, that's
Because it's
why-
not in here. That was my question. I thought.
but it hasn't been spent, that's what.
Right.
I'm
Yeah,
hearing.
that's the thing. It hasn't been spent yet, and we've really come to learn a lot about the process, because certainly in the flow of town meeting, a decision is made, but we'll put the money here, and we would like this to happen. But what we're learning now is what the town's responsibility is when that happens, and the type of process we use for spending that money. I don't think that is possibly something that town meeting knows enough about. It might be helpful for them to know. And so again, because it took us some time to come to this, and the fact that we know that if we give someone $60,000 in mid-February to get anything done, with real quality and real depth by June 30th would not be feasible, that it made more sense to encumber that money with a contract and then allow that entity to really spend time over a period of time doing the type of work we want to do.
Oh,
It's
okay.
a lot of work. It's a lot of
Oh, I
work.
understand.
And back in the days when we had a lot of social service funding in the operating budget, we had a full-time director, community services director, and an assistant, administrative assistant that would process all of this for us. Julie's trying to do it as the health director.
Right.
And it's a lot of work and
So
a lot
town
of
meeting,
expertise that we all don't have.
so town meeting just thought they could put it in with add it to the $20,000 and somehow it would go out and.
That we could just kind of spend it and give it to different agencies.
Yeah,
And it's
yeah.
not, and I think the reason town meeting is under that impression is because many years ago, there was some process by which something like that did happen. But now we're looking at, in 2017, 2017's gone, in 2018, 2019, what is the appropriate way to do?
5,000 to this agency, 3,000 to this one. So okay. So
That's the
Which is now being
CDBG.
done through CDBG.
okay.
Well,
So
you see,
now
CDBG is money that has a very scripted process from the state.
right.
So a long time ago, when the town was doing kind of what CDBG funds does now, through a very scripted process, the town was doing something similar by giving money right out of the town budget to different social service agencies.
And there is this old law that goes back to the early 1900s about that kind of funding. We've never had a read on that yet from the lawyer, but we have asked, and because in East Hampton that happened, and the money was pulled back because of the law. So CDBG is separate, and we don't have to
Right.
look at it
It's
in the same
separate
way.
and it has its own,
But-
yeah.
But the question I have about this, so now the 60,000 is going to help us figure out how the money should be spent and to direct families. Are you anticipating that once this process has been developed, that we will need to continue this every year for 60,000?
I don't believe that's the town manager's thought process.
Okay.
Yes.
No.
But it might be town meeting stuff process.
It might be.
But they could do that, but what would be the purpose if we already have a way of doing this in place, a method to do this?
Are you thinking that the $60,000 in total is gonna be spent on the method?
Well, I think it's going to help us determine how this is done. Some of that,
Well, no,
if you're,
no,
is
the
this,
60,000 is going to go, well, a small amount will be kept for administrative costs, the usual either 10 or 15%. But the rest of that will go to an agency, the lowest bidder, to do this assessment and implementation of a campaign to link Latino families with food programs. So most of the money will go to that by using this bid process.
but that agency is only going to work with us so long as it's being paid.
That's
correct?
right, that's
So
right. And that
once-
will only be,
Okay, so we should learn how that works within town hall, so we can then implement that same program. Or is that off?
I think we're talking about our process. Our process is first we were creating an RFP. And then we
Yes.
found out that the IG said in August, you cannot do an RFP for under $50,000. So now we're using what's called the bid process, and both of these things are written by the state
Procurement laws.
procurement laws.
Oh,
We
I
have to
see.
follow
Yeah.
for any procurement, for any
Right.
service.
Okay, so
for any
that's our
contract.
person.
Right.
Yes.
Okay.
And because we have this new procurement person, we are all learning to, through that lens, to do many things in the most up-to-date, current, correct manner.
Did you have a question, Janice?
I just had a comment that, the pie chart on page 107 is really the veteran service pie chart.
Yeah.
It's not this pie chart.
This is it, cause we noticed that too. Unless they're exactly the
They're
same.
not.
Where's the
Is it no
veteran service?
personnel?
The date, the page before.
Oh,
107.
You know, that's really funny because when I glanced at this page and I saw benefits, I'm like,
Yeah.
what does that mean? And then I
And then
decided not to look at
assessments,
it
yeah.
anymore. Yeah.
Okay, we'll get a fresh sheet on that then.
can I get back to, sorry.
Yes,
Yes.
go ahead.
I know it's a reasonably small amount in terms of the overall town budget, so, but the way I understand, town meeting, it was not in last year's budget. Town
Which amount are
meeting-
you talking about? The 60,000?
The 60,000 was not in last year's budget.
Right.
Town meeting voted to add 60,000 would come out of free cash for that service.
Right.
The town is elected to use some of it to do this little study, and then based on that, this bid, to get properly bidded, and then out of
No,
that.
I think I expressed myself incorrectly. No.
Okay,
We're using our staff person.
step, okay,
Anthony.
so we still have 60,000.
We have $60,000.
That we will then use to give to, or
to the entity
to
that goes
procure
through this bid
a,
process.
whoever is selected in the
Yes.
bidding process.
Correct.
That money will be used.
Yes.
If it overlaps and some of that use then goes into next fiscal year, we'll just use those funds. That's why the
Right.
town manager is
The
not
contract is
budgeting
gonna
that.
cross 2 fiscal years.
Okay. I'm just trying to understand that. So the answer is the monies will be used in the 2 fiscal years, and thus it's not budgeted for fiscal 19. Right?
Right.
Okay.
Okay.
So
Okay,
I
Sonia.
just want to do a clarification on the procurement process. It's great having our new procurement officer, Anthony, because he can take the time to research all of these things, but we've always had the same procurement laws and the same procurement process. What actually changed this year is the RFP threshold for request for proposal rather than invitation for bid. The threshold changed to 50,000 this year. So I just want to clarify that. We've always been following the
Yeah. I didn't mean to say we
procurement
weren't
laws.
following the laws.
I
I
understand.
didn't
You're on
mean that.
TV, I just wanted to be clear.
No.
Yes.
Hey, Sharon.
Sorry.
So you said if it's below 50, but this is 60. Is part of it, it have to be admin, or is it?
I think the 60,000 kind of took us all by surprise. Now what are we going to do with the 60,000? So we're writing RFPs, but we were going to do two separate types of programs.
Oh, I
Yes,
see.
we were
Okay.
gonna
So we
okay.
decided to just concentrate and do one well,
Okay.
basically, is
Right.
what happened. So there's been a whole lot of discussion over the 60,000 internally and externally, and
So there's no longer three things. There is just this one.
Yes, correct.
Oh, okay.
Right,
Okay. Because I was
sorry.
wondering what the. Okay.
I'm sorry. Yep.
And the services for what?
The Latino outreach for food access. Right?
Right.
food access.
Okay.
Outreach for what? Food?
Food.
For food. Connecting to food resources.
Which is one of the public health challenges too.
Correct.
Okay.
More questions? Sharon? No,
So-
it's fine.
The CDGB funding,
Mhm.
did I read somewhere that that is likely to increase
The amount
next fiscal year?
increased? No.
No. Okay.
Community development block grant funding, we are what's called a mini entitlement community.
Mhm.
So that means it's either every year or every other year we get reevaluated on a point system to see if we even get any money at all.
Right.
So there was a time we didn't get the funding, that was in 2013.
Mhm.
But the money is definitely not going up. Nationally, it's something that's being worried about, that maybe it will disappear at some point altogether, but it's not going up.
So this mini entitlement community, is that based on the size of a community?
It's based on a lot of factors.
Okay,
So they look, unfortunately by census tracts, at amounts of poverty rates. They look at many, many different, they have a big matrix for what they look at. And one of the things that the state may be doing in the next year or two is changing that matrix. And we don't know if when they change that, if that will be a good thing for Amherst or not a good thing. Because as we know, Amherst is a community that is kind of half and half. So half our community is very low income and then half isn't. So sometimes the way various mechanisms look to see the need, it depends how they're measuring that.
and one year we fell below,
Yeah.
and we only received about half. And then we became poor again, and
Yes,
we got the full grant.
yes.
Dave, more questions?
Yeah, just, I'm trying to remember the discussion at town meeting. My recollection was when the social service budget was discussed, somebody or some folks remembered some social agencies in town who were requesting funds and were told we don't have enough funds to provide these social services. I don't remember the specifics.
Yeah.
Therefore, town meeting got concerned, I'll use that word, and voted the 60,000. You feel now that there's been a thorough process and that does provide the needs in town.
It has been a very thorough
And that won't
process.
become another issue when someone asks the same question again in the springtime.
You never
He's-
know.
I understand
I
that.
think-
And-
Guarantee that.
And he's asking that because he's in charge of this article and this budget line.
Well,
So,
I
so
don't
he
know,
needs to
but-
have all the
Yeah.
information he
Well,
can
I
get.
think it is true that there was discussion on the floor of town meeting.
Right,
And when the CDBG process happens, only X amount of entities get funded.
right.
So there were some entities that didn't get funded, which is what happens every year.
Right.
But I think that the select board and the town manager felt that you wouldn't necessarily just then go to those that didn't qualify for CDBG funding. It made more sense to get a lot of input from anyone in the community who wanted to bring input forward about what the needs were. And so
Right.
that was the process they used. So yes,
Okay.
it could come up that someone might say, well,
Understand.
we thought, but that, town meeting can't specifically say what processor you can use. And so this was the process that was
Okay,
used.
I understand that.
And I think you're right in that there probably were differences of opinion about where and who should get that money. So I think,
Sure.
so I think,
Right.
and I do,
And-
vaguely recall that there was going to be a meeting to talk about that in general.
Oh,
And
yeah,
it
when
was
it's-
like-
it was who
yeah.
knocked on the door, it wasn't necessarily who the town thought was the most
Right.
appropriate.
Right. And we really
And then
did
you
try
had
to
the-
get a lot of input.
Right, okay. And after all that discussion, this Latino outreach connecting with food resources was the agency chosen or the need chosen.
That was the need
Okay.
chosen.
But it will reach all groups, not just Latino.
Well, it's specifically reaching for Latino folks, but of course what always happens when you do something like that is you're going to discover things that are going to impact many people, and
Sure.
especially other non-English speakers, because we have so many people who speak other languages in Amherst. And so looking at how we're targeting different cultural groups, different linguistic groups, but ultimately you can't help but discover things that are going to help everyone.
Because you have a huge Asian population too.
We do.
So will they be part of this at some point?
Well, it's specifically targeted towards the Latino population because our Latino population has just been growing and growing. In the schools, we're just seeing more and more families every year. And so we have several different languages and communities in Amherst. We've got Portuguese speakers, Mandarin speakers, Creole, and we have a very, very diverse community. But the highest population among those folks is Latinos. But again, we look at whatever entity takes this on will certainly be thinking about how, because no one looks with such a narrow lens, they'll be thinking, well, how will we now be able to extrapolate this in the future to some other groups or to some other languages? Or what are we learning in this process from this group who are not connected to food resources that we can extrapolate to other groups? So for example, in Amherst, we have WIC. WIC, we have an office right in town. WIC that's a women, infants, and children's feeding program. WIC traditionally is always underutilized for some reason. So while they may be targeting the Latino population, they may learn things from talking with people, surveying, focus groups, whatever method they use to find out why people don't know about it or why they don't use it. Some of those things will be able to be extrapolated to others.
I think town meeting will be looking at how broad a sweep we're going to make with that. And so I think that's something the group has to think about, that it's not concentrated on one specific group, that you're going to see ways that can be expanded to help other groups, because you're right there. I think we have something like 30 some languages spoken in our schools. So that is a big number.
Yes.
So, but I do think there are other large communities, so you
Yes.
may want to have those thoughts as we go to town meeting. Janice?
I would think that once you have a lot of the information collected and you could have the information available, you probably could just use that in the future and you don't have to keep putting $60,000 a year or every other year into the program. You just might have to update it from time to time.
Well, yes, and in fact, we've written a little bit of that into this, that we're looking for the development of materials that can be used over time, so that they're not just specific to one period of time, so that different entities can use them, and so that it's something that will sustain itself once an initial type of outreach is done. Yeah.
Sharon, did you have a question? Okay.
Let
Tim.
me, cause I'm not,
Tim
I'm
does.
struggling in
He's
terms
the
of how
minute
I'm gonna
taker,
write this
too.
up, but is it fair to say, A, there are no budgeted dollars in fiscal 19 for any social service program outside of the assistance program, the $20,000 assistance program? That's what the numbers say
In the general fund operating
in the
budget,
general fund
yes.
operating budget.
We have
However-
CDBG.
What?
We have the CDBG money.
That money
That's-
comes.
that's grant. That's
I know,
about our
that is
However,
money to spend.
there may be some needs in town, and because town meeting appropriated 60,000 of free cash, there's cash available to the town that will be used in part due to fiscal 18 to sort of top off the year, and also used in fiscal 19. So the need is being met in fiscal 19, even though the budget dollars are not listed in the budget. Any budget dollars are
It's
listed.
the duration of the contract. We don't know what that is yet until
Okay. But so it could be 3 years.
it'll cross
or-
fiscal year.
Right.
It costs at least one fiscal year.
Yeah.
Okay. That's where I understand it. I just was trying to.
Okay. Well set.
Okay.
Okay.
Yep. Thank you.
Thank you very much, Julie.
Thank you.
Appreciate
you.
that.
Thank you, Julie.
Gave us a lot of information to think about.
Good. Do you want me to send someone in?
That would be, who's, I have, let's see, what did you send out?
She's giving your spare budget, which is that okay?
No.
You can't take my budget book.
Uh-oh.
I thought she might need it for something else.
I will. I will.
Okay.
I'm a good backer.
I see, is the senior center people have been out there a while, right?
I don't know who's just sitting up there.
I know who's out there.
Is that what you want?
Is that what you want?
I think she was there when Julie came in, so she's been waiting the
I
longest.
didn't even look.
She's been waiting the longest with me. I didn't see, what's his name?
Steve, you just walked
Steve.
by.
He just walked by, but I didn't see him when I came in. But I did
He's
see
the veterans guy, right?
Nancy.
Is she the director?
Yes,
What's your last name?
Pagano.
How do you spell that?
Federman.
F-E.
Oh, that was
Wait,
Fetterman.
Julie.
Oh, no,
You're-
no, no.
Oh, yes.
He said
Nancy.
Pagano.
Oh, Pagano, sorry.
P-A-G.
Pagano.
A-N-O. And she's the director of the senior center.
Yes.
Good.
Oh, yes. Okay.
Hi there. Welcome.
Thank you. Small group.
Yes, we had some people who couldn't quite make it, but they assured me they were going to watch us on cable.
Uh-huh.
And people do watch us, believe it or not.
I'd like to introduce Helen McMillan to you. She's been working for the Senior Center 5 years as a social worker. And when our social worker Moore Plant, who I'm sure you might know, retired at the end of last fiscal year, Helen was elevated into her position, and then we hired another social worker to take Helen's previous spot.
So we'll introduce ourselves. Okay, you are?
Yeah, I'm Tim Neal. I drive this.
Oh,
this
We're phone friends.
We're phone friends and email friends because I do driving to the senior center. So, and I don't think we've ever met.
No, we have not. Nice to meet you in person.
Yes.
That's great.
He's not behind a wheel tonight.
We stayed.
We'll be on
Yeah,
Monday
yeah.
and Tuesday.
We rescued you from a 6:30 trip last week.
That's true. I volunteered for a 6:30 a.m. trip or a.m. appointment in Crowley Dickinson on Monday morning in Wisconsin.
Oh, you were
There
lucky
you go.
there.
I'm Janice Ratner.
And
Nice to meet you.
I'm Mary Lou Tileman.
Nice to meet you.
Sonia Aldrich.
Hi.
Sharon Pavilion.
Hi. I know
So-
your facing.
Yes.
Okay, we are on to senior center, and they're growing by leaps and bounds, aren't they?
The number of elders is continuing to grow.
Okay, on page
Probably
one.
be over 5,000 by the time we're at 2020. So,
5,000 what?
people 60 and over in town.
Oh, yeah. By when?
2020. I think they're estimating 5,300 by then. So, and people don't really want to leave Amherst. We know that from our survey. Here's the breakdown of by age.
Yeah.
And you can tell that a lot of folks are living a long time.
Did you
So-
bring some handouts for us?
I did. I just brought what I thought you might be interested in as far as money spent
Okay, the one thing
from
I,
the town
okay,
that to keep us going, and so
the one
Oh, this
thing
is
I
the
have
friends,
used
yeah.
and pull out every once in a while is the chart you gave showing the different years and how the senior population would grow. I think that's really,
yep, it's definitely growing for sure.
Where do you see that chart? Do we have that?
now I had that a few years ago.
Oh, because I was going to ask you
See,
that.
so she, oh, well, you take it right from here.
Oh, good, okay. Because if it's projected to be 5,300 in 2020, what was it like 2010? Do you have any idea? Like, just see how much
Well-
it's grown?
We grew 34.8%
Really?
between the last two federal censuses, and they're suggesting that they expect that same amount of growth between 2010 and 2020. So it's going to be up there. Not every town has a growing senior population, by the way, which I think is interesting.
Say that again?
Not every city and town in Massachusetts
okay.
sees growth in elders, especially not like Amherst. Amherst is particularly a attractive place to retire to.
That's for sure.
So,
I'm sorry, speaking.
so this has been a year of adjustment, a little bit. You know, losing somebody who'd been on our staff for 30 years. Helen has had to try to catch up as a learning curve. And it's a good thing too in a lot of ways, because new eyes on services that we give can help us improve and grow. And I'm really proud of what Helen has accomplished, particularly with her caregiver support programs and the funding she got from Highland Valley, over $5,000 for that. And maybe Helen can speak a little bit about that and where she wants to go with other support groups possibly going forward.
Well, there was an identified need in 2010, the needs survey for the senior center was the need for assistance for caregivers. Getting older means somebody's taking care of somebody, a daughter taking care of mom, or spouse taking care of a spouse, partner. So I applied for money, we're now into our fourth fiscal year of the caregivers grant from Highland Valley Elder Services. They gave us a grant for 2 years for $2,000 a year, which is small, but we got a caregiver support group off the ground, hired a consultant nurse to run that group with me. Also, we're able to hire a resource library, buy a resource library for people, and also, because of the stress, we hired a masseuse. Sounds luxurious, but we have a lot of stressed out caregivers. And also hire stress relief consultants for kind of meditation classes for the caregivers that are very stressed out. I myself come from a background of having a few years of caregiving, so I know what it's like. I had a sick husband at one point, a sick brother that was on my plate, so I know what it's like to have that in your life. Highland Valley loves our programs, so they've doubled the money for 2 more fiscal years to $5,000, $250, and they've actually increased it again going forward at $14,000 for the next 2 fiscal years to increase that programming. We're going to expand it to add a widow to widow and grief support group, and then also we're going to target programming to LGBT seniors in the community also. And then we're going to share all the resources, the resource library, the nurse, the masseuse. And it's also a joint grant with the town of Pelham. So Highland Valley likes that because they see it as a very efficient grant, that we're sharing resources and sharing resources with the town of Pelham. The money tight, the more you can share things, the better.
And we mail our newsletter to Pelham with grant money from Highland Valley. So we had a problem for a few years with the nutrition program being in the black, because the Highland Valley program was based on a formula for every elder that got the home delivered meal, we got $1 something, $1.10. And then, but we didn't get anything for the people who ate at the senior center. And Highland Valley cut a number of the people who were getting the home delivered meal. We have no control over who they approve for that. So our funding kept going down, and so we were going into the red. So after a lot of discussions and them looking at their budget again, they last year added $1,850 twice a year to the formula, which was based on everyone they feed at the senior center or home delivered times 95 cents. So we're in the black. So that was a very good accomplishment, I thought. So you all know that we have 4 full-time people at the senior center. One is partially supported by a grant from the state, the formula grant. And so then we have 3 part-time people that are paid by non-Amherst funds. We have our lunch site director that's paid by Highland Valley, that formula we talked about. We have a part-time nurse who's paid for by a $10,000 a year donation from a resident in Applewood. And then the Friends of the Senior Center also donate $7,500 for the outreach for that nurse. And then the third position has been a godsend. We were able to get a senior aide. It's a job training program that gives us a person, an elderly person, low income, to help us 20 hours a week. This fellow helps us. We have often seven routes of meals to deliver every day, or most days. And he helps deliver not only the lunchtime home delivered meal program we have, takes a route for that, but he also delivers often the UMass Meals on Wheels program, the supper program that goes out in the late afternoon. And he also does a lot of other things for us, making deposits at the bank and that kind of thing. The issue is that senior aide position is only good for 3 years, but right now it's been wonderful.
So that would be the program assistant on the chart, on the staff chart. Is this what we call the senior aide?
So, in my ask for the budget coming up, since we have a little pot of money, because Maura was getting a lot more money and she had the longevity pay, I asked for some consideration of 4 areas. You may have that list. The first was this senior aid person, when the money from the state employment senior aid fund goes away, and he's in the 2nd year now, I was kind of hoping we could find some money to pay him to continue to help us, so that was one ask. Another is we have no, like other departments, but we don't have any training money. And the Friends of the Senior Center who pay our bills, and I passed out that sheet, has been spending thousands of dollars to send us to the Mass Council on Aging Conference. And I'd like to see at least $1,000, which would probably pay for the staff to go to that conference who can get away. And then because that money for the nurse comes from a woman at Applewood who's 95 years old, and she's made it clear that when she passes away, there's no provision going forward. Right now, the Friends are already paying $7,500 for her outreach. I'd like to have consideration of at least around the $7,500, $8,000 toward her wage. So, the part-time management assistant. One thing that we found, there's so much demand for social services. Very often the social workers struggle to keep up with all the book work for the medical ride program and Meals on Wheels, that kind of thing. And so we've been using a tax work-off person, and Helen also coordinates that program. But it would be really good if we had a part-time management assistant to help us with some of that book work. So those are my asks. I don't know what can be considered, but there is a little bit of extra money in there. I am so grateful to the Friends group who have, as you can see from that sheet, paid most of our bills, and the staff do a lot to support the Friends. And as a matter of fact, I brought information about a couple of fundraisers we've got going on. There's one February 9 at the Senior Center, and then we've got, for the second year in a row, a talent show, an Amherst talent show, coming up in March. Yes, in the medical ride program that I mentioned, that program was reorganized last year so that there was a chart based on where you're going. You pay a certain amount to the senior center, and we arrange for the drivers, and that program has been brought into the black, which is really great. And what else? Tax work-off program is going well. You've got 34 or so of the 35 positions filled. Maybe 35, I'm not sure yet.
The which program?
Tax work-off
Oh.
program. Let's see, what did I want to, let's see. You know, we're looking forward to the opening of the Musani Health Center this spring at some point. And I think people are really looking forward to the dental part of that in particular. And so one of the objectives this year is to help that to work out well. We'll see how it works with the parking. We have twice as many people buying parking stickers from us now than when we started the program about 5 years ago. And we're so happy that the price is still $25 for the calendar year for that program, which is available to people 65 and older who live in Amherst. The number of volunteers that we have this last year is about 210, and but that's a drop from previous years, which may reflect a change nationally in that you know, a lot of folks, when they retire from the regular job, are finding that their funds don't carry them through with the cost of living, so they're taking on secondary jobs. And so although we don't have as many volunteers, there are more volunteer hours that people are giving us, which is a wonderful thing. Because we're really, even our phones are answered by volunteers, and volunteers handle everything that the staff is not able to do, so that's pretty terrific. Do you have any questions for me?
Can I just go back to something you said really quickly about the parking stickers? Those are town parking stickers,
Yes,
and you said they're available to people that are 65 and older.
yes. For the lot by the bank center,
Okay.
the upper level and the lower level,
Okay.
and there's about 10 or so spots over on the other side of in Wayland against the trees. You go down Kellogg Avenue.
Mm-hmm.
But it's only, the stickers are only good during the hours the senior center is open. It's not
What time?
from 8 in the morning till 5 at night, Monday through Friday. It's a very popular program because it helps people who, you know, don't have to struggle in all kinds of weather with looking at the machine and trying to figure it out. And, it's been a wonderful, very successful program.
So that's the lot, like the farthest, the most west, the most eastwardly lot on the other side.
You're talking about the one with the 10 spaces?
Yeah.
If you go down Kellogg Avenue to the curve,
Yeah.
on the right,
Yep.
there's about 10 spots
Mhm.
against the pine trees.
Yeah.
Yeah, those are available for people with stickers.
By Share Coffee, right?
No. It's way over. It's like It's if you pretend you're,
You have to go by
You're at the
their
light.
little apartments?
Yeah, just
Yeah.
after the
Oh,
handrail.
okay.
but
and there's
again,
no
Before you
meters
make the
over
turn.
there, right?
Yeah.
But
There's
that's
a
terrible.
sign.
That's
Got it.
Yeah.
Is there also a portion with no meters that
There's
is
no
not-
meters there, there's
anywhere.
signage.
Right, okay,
Yeah.
interesting.
But if you park on the wrong side of that parking lot, you're gonna run into parking for tenants of Avon. That becomes a problem. So you have to park against the trees to avoid that problem.
Interesting, okay,
Mm.
that's interesting. I also have another question.
Great.
So this is money that was raised by Friends of the Amherst Senior Center,
That's right.
and this was for, and this is also money that was raised by the Amherst Senior Center, is that? So this is done by fiscal year?
Yes.
Okay.
Yes. So there are several grants that we have. We have the Highland Valley grants, the nutrition program grant, caregiver support group grant, the formula grant from the state, which is based on the federal census.
Yeah.
Unfortunately, we had hoped to get $10 per elder,
Mhm.
but we got word that that amount was cut back a little bit. So we got 36, whatever it is,
135.
135. So it's a little cut back, but the state,
Well, I was
the
just,
state's going through.
my question was this for, I'm assuming this is FY 17 was 54, and this
That's
is,
what was spent.
that was spent, and this is what was,
This is
what they
part
raised,
of what
or
was
part of-
raised.
Okay, I see.
But we get money from a lot of different
Right.
sources.
Yeah, okay.
And what's wonderful is we've been able to completely fund our newsletter, which goes to everyone in town when they're 59 or older, and has all our information on it. And the number of newsletters, because of the growth of the number of elders, we mailed over 1,000 more newsletters this fiscal year that just ended. But still, we've been able to cover our costs for that, which are substantial.
And under the grants, the caregiver support group actually has been renamed Aging Across the Spectrum to cover the grief support and the LGBT focus too. So it's expanded beyond caregivers.
There are worries going forward for us.
Okay.
One worry is, of course, health insurance is a confusing thing for elders and all of us. And we have a very popular SHINE program, which is a health insurance counseling program. It's free to the senior center, but it's paid for with government money that trains the trainer, and the volunteers that she trains come into the senior center and give the counseling. Well, that money is targeted to be cut. So that's a big worry we have.
And that's called Serving Health Insurance Needs of Elders,
That's
or
right.
everyone, the SHINE. And we're very lucky, the volunteers we have in the senior center, I think 3 out of the 4 people that come in are retired attorneys, which you actually need because health insurance has gotten so complicated. Unfortunately.
That's for mainly the supplemental, correct? No, because everybody's on Medicare.
Right, well, people come in to deal with any health insurance need at all. Medicare, supplemental, their prescription drug plan, pre-retirement.
You mean they need to figure it out and
They might even do a lot of pre-retirement planning. They come in and talk about, what am I going to be doing when I retire? How is my health insurance going to be arranged? There's a lot of choices.
Right.
And then every year people have to re-choose certain plans.
So this is counseling seniors, right?
Yes.
Right.
Oh, okay.
Yes.
And unfortunately, it used to be social workers could understand all that. We would provide the counseling when I started my career, 35 years ago. Now you need a retired attorney to do it. But it's wonderful we have them.
We're also concerned about parking, because we serve people who are younger than 65, and some from other towns, many who are volunteers. They are not eligible for the parking sticker. So that's, I think, part of the reason that the number of volunteers has gone down. We do the best we can to help people. But when the Usani Health Center opens, we're not sure how that will impact parking further. So that's on our minds a little bit. And we're not really sure how the population that's rumored to be thousands of people from even over on the other side of the river, how they're coming in with their various needs will impact us and programs we offer. And so it's a great unknown. And I'm doing my best to think of ways to help folks and make it work. But you can imagine that when let's say you come over to the front of the Bangs to access the health center, which is in the back on the bottom level, we're on a hill. People have choices. They can either come in the building, take the elevator downstairs or the stairs, walk all the way around the building, or down the stairs on the outside of the building. So, it's human nature that people are going to come in the front door and find their way down the stairs or the elevator. And if they're sick, or they have some psychological problem or other problem, or they need directions, they'll be coming to the only open door that's right there, which is at the top of the stairs, where our elders are answering the phone and serving as receptionists. So that's going to be having an impact on the senior center, and it could be very exciting. And it could mean that we have to have more staff time out there in the front office till things get going. Another thing that we're working on.
Sorry, can I just ask the geography? When you say the front door, which is the front door? By
west
Share
door.
Coffee or by
Share
Johnny's?
Coffee. Share.
Okay, that's
Share
front
Coffees,
door. It's not
yeah.
the other one. All right.
Yeah.
So you come in and then you have to go up the stairs
Right.
into the senior center.
Yeah.
Where's the Missani going to be?
Downstairs.
So you go down where the photo
And
hall.
then you go
Where
around.
leisure services used to be?
What?
The leisure services used to be downstairs?
You
That's
go
where
down and take a right,
that's where the
and you
health
go
center
down
is.
to that big
Right.
And
area.
then left
Okay.
and yeah.
So they're all going to come in the front door. They just have to be directed downstairs.
Right. If they come in the front door, or if they come in the side door, which is near the parking lot
John.
by John's
That's the Johnny's
Tavern,
store. Yeah.
they
Okay.
either have to go down the stairs or come in and go down the elevator. So somehow they have to get down there.
Right, but
So
there's
there
a
has
third
to be
entrance.
signage for
There has
that.
to be good signage. And there's going to be their own independent entrance, which is on the back of the building, but I don't,
But you won't see it.
you won't see it.
Right, but then there needs to be good signage, and that would
Absolutely.
hopefully
Yeah.
be something that would be planned well in advance so
Mm.
people can
On
see,
the
because
handrail
so many of
sign?
these
And the
buildings
clock
now,
house sign is
I've
what
got
their main
myself,
entrance is.
there are all these doors all
Yeah, it's
over,
not a good-
and they say, these enter side entrance or enter back entrance. So if you have good signage, that should get
And I
people
think the
where they
building
need to go.
commissioner is one of the folks working on the signage.
Mm.
And so we're waiting to hear what that's gonna look like.
Good.
That'll, yes, will be
It's
very
important to get that right if we can.
Absolutely, you need to get
So-
that right.
So you don't spend your whole day directing people and not doing your job, so.
Right.
So what I'm working on, a separate topic, this year is a little bit of connection with the Center for New Americans. And my intent is to help people from other countries who are elders in that program to become more comfortable with the senior center, participate. And we started off with a wonderful food demonstration that they put on, the people from Iran, and it was very popular. And starting in February, twice a week, we'll have some hours in our conference room with some of their staff. There'll be a soft beginning of a regular event, and then we hope that it will grow and that we'll have then a more diverse population coming in. So that's a focus.
Actually, related to that, we have a free farmers market once a week, and one of the things I've been working on is we have a very diverse population attending that, but we've gotten a lot of student volunteers coming in to translate I was talking to Paul Bachman about it. He thought everyone that came was probably spoke English or Spanish. I said, not really so much Spanish, actually, really Mandarin Chinese, Creole, Portuguese, and Russian were the languages that of the population coming in for the free bread and produce. So we've gotten a lot of UMass students over who speak those languages, volunteering, which has been wonderful.
It's like United Nations.
Oh.
You come over on Wednesday morning, you'll
It's
see
amazing.
that's really an array of people.
And it's always good to have young blood. You
Yeah.
know, UMass students running around talking Mandarin Chinese and helping us out. Sounds great.
Very good. Any more questions? I think you've really covered everything
Yeah.
for us quite well.
Who's in charge of the Friends group now? Who's the lead person at Friends?
There are two people, Tim Atteridge
Oh, he is, okay.
is Etta Walsh. They're, Rosemary and Dick Cuffler, who are both on the Council on Aging. Rosemary was the head of the Friends group. She stepped back from that. She's still on the Friends. And these two other folks are trying to fill her very, very big shoes. So there are changes afoot. There's
Sure.
always with volunteers, but this year with staff, so we're trying to keep things going.
Well, you do a lot on a little budget, I'm sure.
Yes.
A lot of volunteer, a lot of donations, very good.
And I know Nancy asked me for the Council on Aging money. I'm just going to put in a little plug that having two professional licensed social workers is the first time we've had two licensed social workers on staff. We have to we have to have our license renewed every year, so we're mandated to attend conferences like this to receive continuing education units to keep our licenses afloat. And we really are required to have a license to serve in the job. So
Good point. And
Yeah.
that's not something I think that the Friends should bear the burden of totally.
But they are doing that now?
We've never had money for training, conferences or training, and the Friends have been paying the bill.
Okay. Okay. Further questions? Well, thank you very much for coming.
It's always
We
a pleasure.
appreciate that.
Actually, thank you.
Glad you could. It's always a pleasure having the senior center come.
thank you.
Thank you.
Thank
Have a
you.
nice day to say. It's-
Oh, nice meeting you, Tim.
We need to get that publicity out.
Is Kay a volunteer?
Yes.
Yes, she is.
Oh, well, let's do that right now.
Right.
Who's the other
While we're
one?
here.
Melanie?
Mary
For-
Ellen also.
For our viewing
She does
audience,
this
the senior center is
And
putting
then,
on the
With the M.
Karen Carpenter story on
She-
February 11th,
Is it M?
and that
Is it Mary
is
Ellen?
at the Bank
That
Center.
helps us.
Right, it's a
and
soup and
Kay,
sandwich
and then
lunch
also
followed by a
Sue, that helps the
concert.
social worker.
Okay, and
And then we're having our second talent show coming up in March. At the bottom of that sheet, it tells you when
And
that
Kay's
is.
husband was a
Right,
volunteer,
the
and
bell.
then he backed
Auditions.
off, so
Okay.
Shortly.
he was actually doing the rides as
You
well.
can have
I
those.
spoke with
Okay,
her
the Valley
a couple times
Got
today.
Talent, that's at the
It's
Banks
at the Buckley-
Community
She's
Center
catching up with
also.
this
That's the
new
audition,
email we
but the
created,
show
all
is
this
at
rides
Buckley
email, so she
Recital
I think that
Hall.
makes sense.
Yeah.
To send it out
Okay,
and then
thank
just
you.
first
Buckley
come, first
Recital.
serve.
That's what we do with the
Sign
meals
up.
on
How
meals.
many drivers do you have?
8 drivers,
Okay.
and so I added that new email
Yeah.
method, just so it'd be quicker for her, so.
Oh, yeah.
All right, talk to you
Thank
soon. Okay.
Thank you.
Thank you.
Did we have a sheet with what they were requesting for additional funds?
No, we never see that.
We never see that.
No.
She really, Paul officially only requested 5 funds. Paul really only requested.
Look who's here. How you doing?
Town funds.
Alive and
So
well.
that may be a wish list of hers, but I'm not considering it.
A wish list. We're making wish lists?
No,
Well, no,
no.
but people do come in and wish, so.
It was part of the ads list for health insurance as a issue.
Oh,
Okay.
I know. Have a form of verifying. As they say. Okay. And I'm sorry, I'm
Okay.
blanking on your name.
Steve. Connor.
Steve, what's the last name?
Connor, C-O-N-N-O-R.
Okay, I'm taking.
It's
the
become a
names,
very
that's why.
popular first name, by the way.
Okay.
Steve?
Okay. And this is Tim, let's
I'm
introduce us.
Tim Neal, all right.
Janice Ratner.
Yes.
Mary Lou Tileman.
Sonia Aldrich.
Sharon Pogonella.
How do you do?
Okay, you're here to give us an overview of what we haven't read.
Okay.
And usually you fill us in on a lot of interesting data.
Well, what I can tell you is as I reviewed and got ready for the budget, we do two different things. We do many different things, but when it comes to the money end, we do two parts. We have our Chapter 115 benefits, which is the state mandated assistance that comes from the town. We provide it, and then a year later we get 75% of that back if we do it all right and everything goes smooth. The other part that we do is we help veterans and or their dependents file for money through the VA. And there's two ways to do it. One is for a service-connected disability, which is they got a disability from when they served. It may not have come until later, but it was due to that, whether it's hearing loss or a number of things. And the other one is the VA has a pension, and it's for veterans that get disabled after they left the service. And that's federal paperwork that we file. I have anticipated that over the last few years that our numbers in that state benefit were going to go up, and in fact they've gone down. However, our numbers in VA claims to the federal government have gone up. And looking at it, one of the reasons is that the Vietnam veteran, as they're aging, all the toxins that they were exposed to are now coming and messing up, or giving them health issues. I shouldn't say messing up, but giving them serious health issues. So we've been filing more of that. So in all of my 11 towns, that's what we're seeing more of than people coming out. So all of our numbers are going down right now. I don't know how long that'll last, but right now they are. But our federal work is getting higher and higher.
Can I ask a question? I'm just curious on the veterans benefits, and that is there a means test on that from the VA? Like if Bill Gates was in the service, could he apply for veterans benefits?
He can apply for the service-connected benefits. In other words, you've got a disability due to your service.
Yeah.
It doesn't matter what you do. So John McCain gets money every month from the VA for his service-connected disability. He was a prisoner of war.
Okay.
So, but he has injuries and conditions that happen from that. He gets that. The veteran who gets a service-connected, doesn't matter how much they get. As well as if they then die from that service-connected disability, which is some of the things we've been doing lately, is if they died from that, the surviving spouse also gets money, and it doesn't depend on their income either. It's a different amount, but it's still a granted thing that no matter what, they get it.
To follow up on his Tim's
just
end.
curious.
So when you're saying that somebody like John McCain would get that, would he get? Is it based on the injury or the time that versus someone who has a lesser, whatever you want to call it?
Right, a lesser disability. So one of the things would be is if you have hearing loss, but it's not so bad, the VA will say, oh, well, you've got hearing loss, and it's because of this and this. We can agree to that, but it doesn't affect your life that much.
Okay.
So we're going to give you 0%, and you can get free hearing aids. If you have the ringing in your ear, no matter how bad it is, it's 10%. So they say it affects your life by this percent. It's some graph, some schedule they have in the federal government that says this disability affects your life this amount, and they'll give it a rating. It's 10, 20, 30, 40, 50%. So if John McCain, as a prisoner of war, if he has
The whole time, why would that? I mean, I could see where it interferes with your living, being able to make a living. That would be very.
but
serious.
it's also how does it affect your life? Like your work life, and then there's the rest of your life. So people who have
There is.
PTS also have lots of marriages. They may have other kind of issues, sleep issues, all of those kind of things. So that affects your life, but you're still able to work. So it's, and some people deal with PTS by overworking. They're workaholics, where others might be alcoholics, or others might have drug addiction. It's all how they deal with it. But whatever it was creates a thing. I mean, it's not good to be a workaholic, just like it's not good to be, unless,
Which reminds me, I have to
It's-
leave, sorry.
No. You've worked too
It's
long
not even
today.
7 o'clock yet.
That's true, I'm sorry.
You can see we're not having fun
Yeah.
because the time hasn't moved
Yeah, I know.
since we
Sorry, one other
started.
question, could you remind me what the chapter 115 benefit is?
right. So that's Mass General Law, Chapter 115,
Right, okay.
which was passed in 1861.
Whoa, okay.
And what it does is it has a program for the veterans and their dependents. They used to call it the war deads and widows and orphans and stuff like that. But what it allows is veterans who are low income and trying to just get by, or they're homeless, or they're on a fixed income, or their spouses are eligible for financial assistance. All the money that goes to that veteran or dependent comes from the town. My job is to research, investigate the situation, find out if they're eligible, that there's nothing anywhere else, and that I'm the last resort. If I'm the last resort, I sit there and determine how much money they can get. I give them the money, I send all the information to the state and say, we want to give this person this amount of money according to all the regulations. If they say, yep, you're good to go, then next year, 75% of it comes back to the town. If they say, oh, you didn't get that document, they're not really a veteran, did you check this, or they had a bad discharge, or any of those things come up, they're going to say, no, you don't get the money back. Almost all of the money since I've taken over at the town has always come back, and some of it is even at 100% because now you have a homeless shelter. If I assist any of them, which I do, and I provide them benefits, we get 100% of that back because they're not a resident of any town, they're in a homeless shelter. But it is our responsibility, so that's how that works. And we usually there's been in all the years, there's been very few times where we haven't gotten it back, but that's after discussion and finding out what's the best thing to do. Should we go ahead and give this money to help this person, even though the state's going, it doesn't meet this regulation? And we've done it, but that's very rare.
No, I just said.
So, and as far as the other things happening in town, this past Veterans Day was kind of big for here in town. I'm known for like traveling through my towns on Veterans Day and Memorial Day and like speeding to get to everything. I never stayed in anything one place, and I go to different things. But this Veterans Day, we had a thing that was happening at Amherst Cinema, and it was a documentary that was being shown about PTSD and the Ward 8 program at the VA and some of the success stories and this and that. We actually had a panel discussion after that half-hour movie. So we had our ceremony in front of the North Common like usual. Then, since it was nice and cold, we came inside here into the town room. Everybody had coffee and things like that provided by the VFW. And then we walked over, saw the movie, had a panel discussion, and ended it. So it was a big event for the veterans here in Amherst. It was one of the first times we've done such a comprehensive day. So that was exciting. I was happy with that. And we filled up that theater, which I wasn't sure we would, but we did. So that's what we're doing.
Okay. Are we still kind of number one, the leader and trainer for other towns and
Yes,
cities?
yeah. I'm on the state training committee. We have our thing happening in February up in beautiful downtown Leominster. And we are a very efficient office, but we have, because of our caseload fluctuates and we've had a lot going on, and as you guys know, insurance goes up. So I've given numbers. I can tell you that already it looks like they're going to go up from what we first reported. And I should tell you, one of the reasons why is that we had a little bit of a staffing change, and one of the people in my office, her position is being reevaluated through a wage and classification committee, the Collins Group out of UMass. I thought they were going to give us a report in December, and then it has to go through the union. We haven't gotten a report yet, which is making me a little crazy. So I'm working on a budget, but I don't know what the real numbers are. And what I can tell you is that I already see that it's going to be a little higher than what you've got in the schedule at this point, because I'm just waiting. And
Right, I can clarify that a little.
Okay.
The assessment portion of the veterans budget, when we did the budget, we estimated it to be about $94,873 based on the information he had at the time, but it has increased, which we just found out today,
right, just working
for about $6,000.
right. So it's up probably 4,000 over what you've got, or maybe
Okay.
it's, but
Okay.
and again, it's still nothing solid. But we have a district meeting, and so the entire district board meets, and they're going to meet in February to go over all of it. So all the towns are going to look at their increases, and it's going to be increased to every town. But
Our bottom line budget isn't going to change though. Basically, as you can see, we moved the increase from veterans benefits to the admin fee.
right,
And our benefits that we've been paying out have declined.
right. Like I say, our numbers for the state benefit have gone down,
Right.
and what we've been doing a lot of is
So it washes out.
the federal
Just
work.
the statistics showed pretty constant over the last 4 or 5 years of something like 40, high 40s veterans in Amherst. And then it dropped to 34, but the dependents increased. Is that obvious that some of the veterans died and they were now providing more benefits to the
To the
dependents?
dependents, right.
Okay, interesting. All right.
Right. But all of those numbers are actually down, all of them. And what's gone up is the VA, the federal paperwork. But we just got a gentleman here in town, 80% service connected, like a month and a half ago. So he's happy. I'm happy. We also work a lot with trying to help veterans here in town, and we've done it a few times this year, into the Hoyoke Soldiers Home. And that is a form about that thick. So we get a call from the spouse going, I gotta get him into the Soldiers Home. Okay, let's go through this. Here's the application. It is, it's quite an extensive application, so that's a lot what we do now.
Is there a long waiting list for the soldiers' home?
They changed how they operated about 2.5 years ago, I would guess. Instead of having this long waiting list, and I remember when I was younger, you wanted your husband to get into the soldiers' home. You called up your house,
Right.
your representative, your state senator, and they'll get you in. Well, everybody started doing that. So it didn't mean anything. Everybody was calling their state senator.
Right.
But the list just got so long that it was. So they met, they decided that they were going to do it based on urgency, on need. So I've had veterans, and actually I had one last year here in town, who they wanted him to go into the soldiers' home, but in the meantime, they put him in a nursing home. And there was enough resources. So they're like, well, then he's not an emergency. I had another veteran who was walking out of the house, walking through in his pajamas in January last year, in the snow.
urgency.
Yeah, there was an urgency, and they didn't have the ability to put him in a nursing home at that point. So he became a priority and they got him in. So it's now prioritized based on need, rather than just, well, you're gonna need it someday, we're gonna put you on the waiting list. You can kind of pre-do it to a point, but when the time comes, when a bed opens up, they base it on who really needs it the most, and there's an assessment done.
Do we have any, sorry, one quick question, any women veterans in our service?
Yep. You have 2 currently, and last year we had 2, unfortunately, had gone to the homeless shelter. But they've been housed, so that's success stories. So, yeah. Yeah, we've always had, I don't think there's ever been a time I haven't had at least one woman veteran on here in Amherst. And Northampton's the same way. It's just,
So I'm assuming you work with social services in town here, because Julie was just here and talked about, there's a little bit of money to get people into housing, last month rent or
Right,
security, whatever. So you work with that. Then we probably make sure that they have enough of an income after that to be able to
stay housed.
stay there. So
Right.
do we have places in town where housing is less expensive and they can afford to live there?
What happens is and so we have veterans come in, especially if they've been homeless, and there's a lot of gentlemen and 2 women in Amherst that have gone through the homeless shelter program at Soldier On. And they get what's called a VASH voucher, which is a VA supportive housing voucher. Gives them a caseworker, but it's also a Section 8 voucher, which means it's 30% of their income. So if they're on SSI and it's only $750, they only pay 30% of that. And a housing authority picks up the rest. And we supplement their income. So that allows them to stay housed. That's how that program works. The other thing is if they're not needing a caseworker and they can basically manage, we wait until school gets out. Apartments open up, we find some of those for the veterans. I give them first, last, and security to move in. And if they've been in a homeless situation, I've helped them move in, that's when we get 100% of that money back. It's when we move people in under that condition. So, and then we support them as long as we need to, based on their need.
Very good. Further questions? Okay, well,
Thank you.
well, thank you.
Thank you very much.
Much information
Thanks
from
for
you too.
listening to me.
Well, thank you for waiting so long.
Well, it's only 7:15. I can still go home and feed my pigs.
Can you let Mark know?
Oh, yes.
Can we take just a brief break?
That's off of your radar.
Don't expect that to be.
Oh, you did?
We can't sell a minute show.
Okay. Well, congratulations on your new position.
Thank you.
Welcome
Appreciate
aboard.
Glad to be here. And I don't know if you've met Donna Roy, who's our operations.
Hi.
Hi, I'm Mary Retirement.
She's the
So
chair.
we've already done it.
Yes, that's what
Oh,
she
okay.
said. So,
All right.
and you're glad to be in the position even with Cherry Hill, right?
Cherry Hill. We'll talk about Cherry Hill.
Yes, you
At least we're
will.
not the ledges.
Yes, after reading about that in the paper, for sure.
It's a good golf.
It's a nice golf course.
But they've made the paper recently.
I
They're trying to
know,
figure
I
out
know.
what to do with them.
And an owner.
Okay,
Cherry Hill is misnamed.
so would you like to give us some information that?
Sure. Well, I know you've had a long evening, and I'm going to apologize in advance. I still have this lingering cough, so if all of a sudden I've got my cough drops in this, so I'm doing the best I can here. So I think you've seen that. I'll start with the leisure services budget.
Sure.
And I think you've seen that there's a 4.6% decrease in the expenses, and that's basically due to the reorganization effort that we went through to reduce our expenses and to increase our efficiency. So if you look at the organization chart, we've eliminated the assistant director position and have streamlined much of the other positions. So it's a much different chart than we've had in previous years. We eliminated the after-school program director, or I should say program coordinator position, and converted that position into the youth outreach and special events coordinator position. So that was a change, as well as filling a long empty position, which was the marketing and registration coordinator. So that now is filled. So we feel we're on good solid ground, and we're going to forge ahead and do some very good work that we have planned for the next upcoming fiscal year. So just in terms of our recent accomplishments, as you know, we're now offering swimming lessons and open swim at the middle school. And that's something I know that town meeting has been looking for several years now. So we're back. We've been able to collaborate with the school department on that, and it's going very, very well. I've already mentioned we've reorganized the department, and we also eliminated, as I referred to earlier, we eliminated the after-school program coordinator position, and so we eliminated that program at Wildwood, and we worked with the principal there to just improve that program delivery. There were 2 programs there they were competing against, so our program only had 14 children in it, so we were able to integrate them into the other program, which was a stronger program, and it had a longer history there. So that was a change. So we're trying to, as again, just sort of streamline and become more efficient as we move forward. Let's see, one of the other highlights from this list that I have here is we have a group that's looking at basically the downtown recreational groups, recreation facilities and fields. And we now have a consulting group called Weston and Sampson. I believe they're out of Boston, and they'll be coming up with some design plans for that area. So that's exciting. Lots going on. So any questions on sort of what our challenges and accomplishments?
Just a question
Sure.
about the after-school programs.
Yep.
Are we involved with Mark Smith's gone, Crocker Farm and Fort River?
Yeah, we are involved. We have a program at Crocker Farm. We serve 99 children there. It's a very strong program, and we are not. There's another nonprofit that runs the program at Fort River called
Okay.
Capacidad.
Okay, so we only have
We only
one
operate the one program.
program.
Mhm.
Okay, and the others are privates.
They're run by private nonprofits,
Okay,
501c3s.
thank you.
Mm-hmm. We do sign an agreement with the schools, however, in terms of, we all provide the same services and agree to a level of services. We're also licensed by the state, as those 2 programs are. So we're offering, basically the same types of programs for the children. So as we move forward into 19, we have really kind of an ambitious agenda in front of us. We're going to, first of all, we're going to implement a new resident and non-resident fee policy for leisure services. And this comes out of a cost analysis study that was done last fiscal year. So we're going to utilize that information to actually look at increasing probably our fees for non-residents. Currently, every program operates at like a $10 extra fee. Well, that means if you're planning for a $50 program, $60, but it could be a $400 program. It's only $410. So you see where I'm going. So it should be based on a percentage. So we'll have to look at recommendations, look what other towns are doing. It will probably be in this 10% area though. So it will be based on a percentage, which will increase our revenues as well. And I think it will make a lot more sense. The The other thing we're striving to do is to collect 100% of program participant evaluations, so that we have a good hold on, you know, what we're doing, what we can change, and what we can do better. We'll also conduct a strategic planning process, and that's tied into the capital budget. We requested funds to help fund that strategic plan, so that we can excuse me, look at our vision statements, our mission statements, and set up some good objectives as we move forward for the next 3 years, instead of just sort of doing things, you know, because we think it's good. We want to make sure it's good for the community. We want to make sure we get community input as we move forward. And that holds true for the next bullet point, which is to conduct a feasibility study that will look at really our name, our branding, our logo. We've been leisure services. What does that mean? It's confusing to a lot of people, so we're going to evaluate that as well. Other areas we're looking at are our online registration process. We've already made significant improvements in that process, and that has been largely because of Donna and her efforts, and the new gentleman that we have now working for us, who is our registration and marketing coordinator, who filled that position. So it's been great, but more work to be done there, certainly. One of the goals that we have is to expand our collaboration with the local businesses, the BID, the chamber. I think if you've followed a little bit of what's happening with Winterfest this year, we've expanded to a week-long program. We have 45 plus different events going on during that week, and probably 25 plus different venues. So really exciting, but we couldn't do that without those collaborations. So that's been good, and plus we have a great volunteer community. So we've got community buy-in, and we've got community members working really to improve the quality of the programs and so forth that we're offering. So good stuff. I'll put a plug in for that. And I've already referred to the Weston and Sampson study. That is the recommendations and the plan that will come out of that. And then again, we're continuing to work with the schools to find spaces for our programs. We have streamlined our adult education offerings, basically because for many, many years now they've been under-enrolled and or not enrolled at all. So we really took a look at that, a hard look at that, and condensed what we were doing and are offering programs that people will sign up for and have had a history of signing up for. So that's the latest and greatest for the leisure services and what's on tap. Yep.
Do you have like a kind of a rough estimate of how many non-residents to residents you have in your
I'm
program?
going to defer to Donna percentage-wise.
Percentage-wise, the majority of our program participants are residents. There are some programs that are like regional school students, like for basketball and skiing, and Nazi National Ultimate Training is largely non-resident when it comes to their participants, but otherwise.
You have to do, it's probably along lines with what the school, the regional school deals with, in terms of to break down that percentage, whatever the percentage it is for the students who attend from Shutesbury, Leverett, and Pelham. It's probably about the same as we do, as we have for our programs. I can't pinpoint the exact percentage, but probably 5 to 10.
So kids that go to school together at the high school, middle school, but then do the like the basketball program or something. Those kids that are from at Amherst are going to have to pay more. So those families are going to have to pay more.
They do,
that.
yeah. Generally, they pay that $10 non-resident.
Yeah. No. Okay.
Yeah.
Let me follow up with that. So if they're using the regional facilities, they're required to pay more?
If they're a non-resident for any of our programs, they're required to pay $10 more.
But those towns own those buildings.
They don't necessarily just, but all our programs don't happen in that building.
Okay.
Yeah.
So I guess that was one question that I would have. If we're using the regional facilities, why wouldn't you know, those kids get the same price. If we're not using the regional middle school or high school or their fields, why then, you know, we're using other fields, then the price would be different. I don't know how that's worked
Yeah.
out.
It could also be that when we do these, when we do this analysis, you know, and if we look, when we really look at this, that we may have 3 different tiers. We have a regional, or maybe there's, I can't say.
Oh, you're
we haven't
looking.
formatted it
Right.
yet. But I appreciate your input.
Following up on that, but, because I was wondering too if the regional students would pay more because they're from other towns. But there are more costs involved than just the fields or the school. There's the administration, the program, the.
Mhm. Yeah, and none
more
of
to it.
those towns have any recreation. They pretty much rely solely on what we provide. And, yeah.
And I appreciate that you're looking at the non-resident fees because we've been talking about that,
Huh.
and it's not just leisure services, but
Mm.
there are other programs in town that non-residents use, and it's really not fair for the Amherst taxpayers to be subsidizing all these other people.
A little history on LSSE goes back to the 70s
Mhm.
when I was on the committee,
Yeah.
school committee. We collapsed.
You got it.
There was an after-school program which was mostly, you know, classes, music classes, and classes for kids after school. And it was run by, I can't think of his, Paul Healy.
Hmm.
And the town had their own stuff. And we said, why don't we, again, fiscal crisis. So we combined the positions and had the town run it. And we came up with this wonderful LSSE that has stuck for years. Leisure services and supplemental ed. And, you know, get rid of it.
Okay.
You know, it was something
Yeah.
to make people feel good because we combined these. And the schools continue to offer
Mhm.
classes, you know, summer school classes so kids could make up a course. And that seems to have fallen by the wayside, which is too bad.
Yeah.
But it was a combined, I think it worked for a while, but now times have changed.
Yeah, I think it's important we have something that better, you know, brands us, describes what we do. And, you know,
Absolutely.
Probably a recreation permit. But. All right. So, any questions? Any other questions?
Maybe I'm jumping ahead,
No,
but
go ahead.
looking at the budget question,
Mhm.
there's money for personnel and then there's money for operating expenses. I'm assuming the instructors in all these classes get paid some stipends, right, for that?
Yes.
That comes out of the
Well,
operating
it's a percentage of
expenses,
their
right?
What are we looking at?
I was looking at page 110.
That would come out. Their fees.
So the person who runs the dance program gets paid a little stipend.
Yes, but not from the operating budget,
Right.
from the
Oh,
revolving
revolving.
fund.
Yeah.
From because it's all
right. Thank you.
fees that come in pay for that.
Oh, okay.
Now, do they get this, some benefits that town meeting voted if you work a certain amount of hours, like this
No,
summer,
most
the
of
kids
these
are
are done on a
missing.
contract basis.
Okay, so they don't fall into that category.
Right.
They're not salary.
Independent contractors, maybe
Okay.
W-9s and contractors.
So nobody has a salary, even a couple hours salary from the town.
Not the instructors, no.
Okay.
So what do we spend 222,000 in operating expenses for?
Well, it comes down to the salaries for the supplies, salaries for the full-time and part-time staff.
Well, that wouldn't be the salary. The salaries would be under personnel.
Oh, your operating,
I'm looking at, do we have, the FY19 budget is 393,680 for personnel.
It's not
Which-
subsidies.
subsidies,
That's mostly the
subsidies, yeah,
It's under the
I'm
operating
sorry.
expenditure. Subsidies
Oh,
are there.
For the
Right.
students.
sorry, misunderstood your question.
So it's called personnel services?
No.
No,
No.
Operating
No, it's called
expenses.
operating expenses.
Expenses.
Oh.
The program subsidies.
I see.
Oh, all right, down in the pie chart section, it's 207,000.
Right.
So that's the big component of that.
So the rest would be supplies and so forth.
Okay. Thank you. It's
Yeah.
got paper and pencil.
Sit-
I understand that. Okay. No, seriously, I was
No,
just
yeah.
curious. Thanks.
Since money was added by town meeting, and there, I think the subsidies have been increased, have we seen greater participation by children from low-income families?
Yes,
Okay,
we have, that's the short answer.
that was the intent.
Right. We utilize all of that money. It's really interesting. We've seen the demand go up, and we'll be doing, one of the things that the town manager has asked for is it's sort of a breakdown on like 3-year analysis on where that money has gone. And so it would be able to provide you a little more in-depth, but I will say, and I'm gonna let Donna speak to this a little more, because she keeps an eye on this. Handle on it.
Okay, so last year we did spend all of our money. The way it's broken out is part of it is slotted for like leisure services, and part of it is slotted for the after-school programs.
Okay.
So last year we actually used some of leisure services, some of the additional 105 to help cover money that we had previously gotten from the CDBG grant to cover for the after schools. So we did spend all of our money last year and a little additional above and beyond what we were given. And the same is true in the 2 previous years. I went back from and did FY18 where we are currently this year, and again we are on schedule to spend our entire allotment of money. Again, giving some additional money to the Crocker Farm after school program because we work with the schools to help get some of the families that participate in the Steps to Success program into after school. So we work with the school with that program as well. So we will have all of our money spent.
So that Steps to Success is what?
Steps to Success, they work with low-income families who also have a need educationally for improvement, either in reading or math. It's part of the Title I and the Title III program that the school offers. So they do Title I and Title III on Tuesdays and Thursdays for a portion after school, and then they come to our after school program after until they get the bus home.
Okay, so I'm not asking you now, but do we have numbers for all of that?
Numbers as in participant wise?
Right.
Yep. So this year for the Title I and Title III program, we have 17 students who are participating in that. And then just regular Steps to Success students is 16. And those go Tuesday, Wednesday, Thursday for the regular Steps to Success program. And the Title I and Title III do Tuesdays and Thursdays.
Good.
And it started in November and runs through June.
So do you see greater numbers coming up?
Usually they start in December for the Title I and the Title III, and once they start, that's usually the number of kids that we will have. And the Steps to Success children, they start in September, sometimes in October, but usually what we see at the beginning of the school year is what carries through to the end of the school year.
And you have parent involvement? Or it doesn't require? Is it required?
We have parent involvement in our program generally, different times during the year, but most of the parents are working, so that this is their child care, as well as supplements their educational programming and then the recreational programming as well.
Thank you. Any questions at this point? Okay.
So we'll proceed with municipal pools. That's fairly straightforward. We had quite an increase in our public swim lesson participation this summer. Last summer, we were up 77%, not 70, excuse me, over the calendar. This is calendar year CY, calendar year 16. We also provided 470 day passes to the Amherst Survival Center as well as to the Amherst Family Center for low-income children and families so that they can come utilize the pool. It's been a great collaboration with especially the Survival Center. So we find ourselves now collaborating with them on even events like Winterfest. So it's a good start to a good partnership. As far as going forward, as you know, you've heard about the Golf Park Spray Park, so that the landscape architect design team was selected and is in the process of developing some plans, and there'll be public hearings and input on those, and then we will select the plan and hopefully break ground either in hopefully September 1st. It could be into September, October at this point. So we're looking forward to that. This Amherst Recreation Working Group that I referred to earlier, the War Memorial Facility will be part of that in terms of recommendations as to what will happen with that building. As you recall or may not recall, the pool itself was refurbished about 5 years ago, and it looks terrific if you see the deck and the shade structure, and then you see the crummy little building behind it, which really needs upgrading. There's some serious structural issues with it was built in 1955, I believe, so it needs to be replaced. And then they'll come up with whether or not we'll have a spray park there and a playground. We'll see. So we'll see what those plans hold for us. We're doing improvements this spring to the filtration system at Mill River. We've had some issues with that, with the pump and the filtration system, so those will be taken care of. And that was, I believe that was capital money. I'm trying to remember, or if that was CPAC money, but I think it was capital. So that's being taken care of. We also just doing our best to make sure that no child is turned away for lack of ability to pay for their swimming lessons. So it's, that has gone well for us. So let's see, providing discounts. It was a good year this year. Although it looks like, if you look at the numbers, it looks a little bit like, we were down from calendar year 16. Calendar year 16, if you recall, was a really, really hot summer. And so, as you know, weather has a factor in the daily attendance records or rates at the pool. So, but our lessons, which I think are extremely important and just critical, actually, so they have gone up. So that's a very good sign, considering that our population, students or children at schools is going down. So it's good that parents are enrolling their children in swim lessons. And we're trying to keep those at a reasonable price, so it's affordable. Questions?
So when do you open the pools?
We generally open the pools I'm gonna say right after school ends. We actually open one of the pools usually around the 18th, Mill River, and we host an 8th grade field trip for the middle school. So, and we have a swim meet there as well before we actually open to the public. And that generally happens around the 22nd. I don't have the firm date for next summer yet. We're just putting our brochure together.
So if you have a warm June, there's no way to have, or it's not feasible to have the pool open just on weekends, even though school is in session during the week.
That's something we've thought about. We actually will have a middle school pool that's open through the end of May, and then that's actually an extension. We didn't have that at all before, which is a good thing. I'm not saying we couldn't do what you're suggesting if we had, but it really is a question of getting that facility open, which is that DPW handles. It takes some time between April and June to get everything repainted, you get the water in balanced. It doesn't sound like much, but it's a pretty big process. At some point we'll look at getting a liner for that pool like we had at War, and that basically is turn it on and fill it up and then get the chemicals right. But you have to repaint and patch the pool every year. It adds onto your timeline, and then if you have rainy weather, also this particular paint has to cure for 2 weeks.
This is Mill River.
This is
or-
Mill
or-
River.
Well-
War's great, it's got a liner now.
Well, if you had War Memorial, and that was just the only one open on weekends, I wonder if that would
Yeah,
help with
It's a good
revenues.
suggestion. We just look at the budget,
You know,
see if we could afford it. I mean,
you know, but it means
Depends on
getting, you know, people to lifeguard and that, but
yeah.
But weekends, you know, if you could open maybe, and it was warm, maybe it would be a little more revenue there.
Mhm.
Depends of how much has to go out, of course.
Why would you be more revenue?
Do we charge to use the pool?
Excuse me?
Yes.
We do. I didn't know that.
Yeah.
Passes, swim passes,
Yeah.
lessons.
It's fairly nominal. I mean, it's $3, $2.
Oh. All right.
Then we have memberships. Yeah.
Ah.
Okay.
Pools are going
Janice?
strong.
Janice?
So you have non-resident fees for the pools also.
We do for memberships, yes.
What about daily?
Daily, yes. So daily admittance and for residents, and then if you're a non-resident and your child's taking swim lessons, you pay the extra $10.
And there was also, my question before your presentation was, why is Groff not going to start construction until September? But I guess it's the whole process you have to go through before you start. That's what it
Yeah.
sounds like from your presentation.
Right. You know, and I think that Dave Zelnick is actually heading up. He started that process before I came on as director, so I would defer to him. He's not here tonight. I think, you know, it's going to take some time to get all that public input. So it could happen earlier. We'll see.
Because you'll miss the whole summer.
Yeah.
That's the problem.
Mm-hmm. I agree.
Okay. Anything else on pools? Are we charged to use the middle school?
Yes,
Okay.
the same. We only charge a daily fee there because we're just open on the weekends. We don't have a membership.
Oh, okay.
Okay, Cherry Hill Golf Course. Let's start with the good news. Revenues were up 13% over the same period last year. So we've had a good first few months to the fiscal year, which is good.
Say that again.
Revenues are up 13% over the same period last year, this fiscal year.
Is there any reason we could go to a calendar year as we do with the pools?
What's interesting, I think that's a good suggestion. It does get confusing.
Yes, it does.
And I think it was 2 or 3 years ago, the town manager recommended a calendar year for the pools, but I'd be whichever.
Why don't we ask him?
Yeah, okay.
I think it makes some sense
Yeah, no, I
because,
agree.
you know, you
It's very
split it up to June 30th, so you have that.
Mhm.
Depends on the summer, and
Mhm.
it may show up very differently.
Right.
I'm not sure, but
Yeah. No.
I would prefer to see calendar year
Uh-huh.
for the golf course also.
Thanks. Yeah.
Why?
Probably.
Everything else is.
But yeah.
No, the pools
No,
are
the
not.
pools are-
I know that, but I put the pools in the fiscal year too.
Yeah. The pools.
No, they were, but it
No, I don't know.
breaks
I mean,
it
just-
breaks the season. It's not. It's a seasonal thing, and it breaks it right.
Okay.
Yeah.
All right.
In a way, though, I would like to say though that the pools still reflect a fiscal budget.
Right.
See, so
So the
It-
revenues
it's
are
almost
fiscal, everything's fiscal, you're just
Your
talking about
numbers-
the enrollment
the
numbers.
enrollment numbers
Okay.
are the only thing that's
Right.
calendar year.
And you know, I'll have to tie in.
We can't break it up to be a calendar year.
Okay.
Yeah, I mean, yeah, if you're tied in.
Well, it might just be interesting as like a supplemental
Mm-hmm.
grid to see what it is year to year. I mean,
Mm-hmm.
We go through great pains with accounting, ask Donna, to make this work out fiscal year.
That we do.
We have so many sets of numbers,
Yeah.
deferred revenues, and deferred expenditures. and-
But you're up to the challenge, that's the
No.
thing.
I'm
No,
getting
no,
a
no, no.
negative on that request.
We all decided we were not gonna go through that again.
Yeah, if anything, well, we have, one of the things we're looking at too is our revolving accounts are just so, it's laborious. I mean, it's just
Robust.
too much. Robust, that's my
Yeah,
word.
there's a good word.
Yeah, we need to look at streamlining.
A genteel
those. I mean,
word.
We did this for a reason at one point years ago,
2 or 3 finance directors
Right.
ago, yeah.
and I think now it's time.
Time has come to get rid of that.
Yeah, it's just too much.
But how would you
We
do it?
don't need that, and it doesn't. And, well, we have like this, instead of having, I don't know, let's say 25 different accounts for sports camps, we just have sports camps.
Right, have a revenue and an expenditure
Yeah.
account, end of story. We have breakdowns for everything in all of these programs.
Yeah, each program has about
Pretty-
15 individual.
It's pretty impressive.
Yeah.
It's like, whoa.
It's very labor intensive. Yeah,
Yes.
And if you changed it, it would be better.
it would definitely. I think it would definitely simplify things, and make it more accurate because. We were talking beforehand, and you had a good example.
Yeah, so like for our youth instructional or youth educational programs, it's broken down by like driver's ed, college education classes, and then just regular youth instructional. But any fees that are charged non-resident or registration fees go into one youth instructional one, so it doesn't actually show the real revenue per program.
Right.
And then when you take the expenses out, it comes out of just one gigantic account. It doesn't break it down the same way it breaks it down in the revenue. So when you're trying to balance like per program, it's impossible.
That's an
It's
easy
not
fix.
So
Is
are
that
you
an easy
moving,
fix?
are they moving toward
Simplify.
simplifying?
Well, we're proposing it.
Is that your easy fix?
Oh no, just we'd add more accounts, but that's an
Oh.
easy fix.
No, I don't want to add more accounts. I kind of want to limit the accounts.
Well, you gotta
that
split
we
up the
have.
revenue, right?
Well, that's what we're doing. Anyway, so it's something to consider.
Okay.
I don't want to, bog you down now.
So we have more golfers.
So we had more golfers. Yeah, we had some more revenue coming in. That's good. We also started a program where we were selling passbook. So you buy 10, or you buy 9, you get the 10th one free. So you can buy your rounds ahead in advance, which is fairly successful. And that just started. So we just sold 32 of those books, and there are 129, I think, each. We're still working on course improvements. We've worked extensively. The tee boxes and they're much better. So we made some improvements there. We're still working, doing tree work in collaboration with the Stockbridge School. We provide their students that come out and do the tree work for us as part of their curriculum. So that's really a great collaboration there, as well as their soil, insect, and I forget the third thing, science department. So they've come out and done studies on our greens in the past and have made recommendations on different how we should use an integrated pest management system using less chemicals. Obviously, that's our goal, and trying to be as green as we possibly can be. The Amherst High School is utilizing the course as their home course, as well as Frontier High School, and that has been well received. So we've got two teams up there now, and we're still working to just keep expanding all the activities that happen on the shoulder seasons, whether it be Nordic skiing, which we got a grant to purchase grooming equipment. So we have now, I don't know if any of you have been up there, but yeah, I thought you did. That's right, you're a good skier.
Ski right over there.
Yeah. So it's really, when we have snow, it's great. It's groomed. It's a nice groomed trail, and our superintendent keeps it up nicely. We don't charge. We do ask people for donations, but there is no charge for that. And the other various activities there that we offer are listed. So going forward, obviously, we've had a history, there's been declining revenues, and I think that's true with the golf industry in general. Speaking with the town manager, he and I came to the conclusion it was time to really appoint a blue ribbon committee to examine all aspects of the operation, as well as what other potential uses could we look at in terms of what is possible there. So that will happen in FY19, and we'll get recommendations, and that committee will consist of obviously people from the university and people with expertise in this area, as well as community members. So that's sort of the next step. It's an evaluation step. Look at what we're doing, and then we'll make recommendations for FY20.
Will you have outdoor people on there and golfers so that it?
Yes, I think it'll be a balanced committee. It's not just
important.
golfers.
No, not just
No.
golfers, but on the other hand, I would not want to see them eliminated because they like golf courses.
No,
Yeah.
obviously. Yeah.
So, and the Nordic skier and,
Sure.
and though, as you say, a balance all the way around. And then what do people have ideas what they would do with that amount of land?
Mm-hmm.
Yeah.
So we'll find out.
Mhm.
We'll see what recommendations come out of that. So we'll continue our specials. We're still working, certainly, doing as much as we can. Like I say, on the shoulder season, we've done disc golf tournaments there. We've had, you name it. We've had oompa bands for Oktoberfest. We just opened up to the community. Cinda Jones Mill District, and I've talked about doing a jazz concert there in June. So there's other things that we're trying to add just to, it's a community asset. It's an incredible piece. It's a gorgeous piece of property, and it's only utilized by golfers for the most part. So we're trying to expand that. We've talked about that before, but we're continuing to do that. So the budget actually went down, and again, that's based on the I missed it.
Personnel services.
The reorganization.
Yeah, the reorganization. I'm sorry, I just misplaced something.
Here, do you want this?
Yeah, well, maybe it's just no. Yeah, so we're down. That's right. 5.9%, which is that's reflection on the reorganization as I referred to. So it'll be 10% of my time, and then 10% of the sports director's time, in terms of overseeing the clubhouse operations, which he will oversee. And initially, of course, he's new, so I'll be training him. And then the on-course operations, I will still supervise the superintendent. It was full-time benefit.
Questions?
Yeah.
Jazz?
Can we ask about the capital appropriation line here? Or do we have to wait for JCPC?
No, you can ask if they're asking for capital.
Yes, let me just flip over there. For the golf course, specific, we have asked for what's called I believe it's a workmate, and it's a piece of equipment that's used daily on the course, and it is basically, how do we describe it, as it's a little four-wheel drive vehicle
Like a gator.
with a gator. Yeah, that's what we decided. A gator. So we got a gator, and it's got a little dump thing to it, and it's when we trim trees, we throw stuff in there. We have to haul seed, we throw that in there. So it's just sort of this. That's why it's called a void
Small
tip.
dump truck.
Small dump. If you got
Oh.
like a miniature dump truck, exactly.
But it goes on the golf course.
It goes on a golf course.
Like the size of a golf cart?
So work.
It's
a little bit big.
supercharged golf cart.
Oh, it's a supercharged.
No. It's
That's pretty much, yeah.
Imagine a pickup truck that's small.
I know, but I'm trying to figure size, and I know what a golf cart
I'd
looks
say it's
like.
about That's
Yeah.
a little
it's
narrower
larger
than
than
this,
a golf
Narrower,
cart.
and about
Yeah.
as long as
Yeah.
this.
It's smaller than it's bigger than a bread box,
It's
right?
bigger than the box. You got it.
And that's the 39?
That is
That's
the
all the 39?
35,000 broken into 3-year lease to purchase, which comes out to 11,700. And then
11,700 a year.
11,700, yeah, 11,700 a year, and there may be
And then
one last payment on another piece of equipment. Yeah,
Mowers or something.
yeah. No, it's not in that year. That's
This is in
interesting.
for 39,000.
Yeah, that's interesting. Unless it was decided to put the whole cost of that equipment in there instead of leasing it. That's because there was discussion at our budget hearing about leasing versus paying outright. So maybe that change was made. And I'm not aware
Yeah,
of
the
it.
capital appropriations change as the capital process goes through the year. Because not everything gets, this is basically what was asked for, not everything gets approved, so.
Hmm.
so is this a versatile type of machine?
Yes. Certainly so.
So what you're saying is that it might not be like this by the end. It might just be the 11,000.
So when you buy this equipment over time, is it less expensive or more expensive or the same?
It's well because I think it's more expensive because you pay interest.
Okay.
We started this. It wasn't just us, but DPW has done this too, because I think it was when times were not as good, and it was easier to stretch out and
Right.
pay less if there was less money in the capital appropriations generally for the town. Is my understanding.
So it will only be used for the golf course or other places in
It
town?
certainly could be used for other places. We share equipment with conservation. We share, depending on
Okay.
if something comes up. Yeah, absolutely.
And that's how you sell it?
I think it benefits every. Even if the golf course, it wasn't there, it would still be something that DPW could use certainly, and conservation.
Right.
It's just a very versatile piece of equipment.
Good. Is there any questions from our group? Okay, do you have anything else that you'd like us to know about?
I would just like to say, first of all, just thank you again for giving me the opportunity to, in this position. It's my dream job, so it's been great.
Oh, how nice.
And just to have Donna and Roy on board as new operations manager, just the whole, just the way we're going, the direction, just feel really good about how things are going. So, and I appreciate everything you do as, the volunteering for, all the hours you guys put in. It's just amazing. So, very impressive.
Well, we're very impressed with staff. We really are. I wish more people would watch and see what a great job this town employees do for this town, all the wonderful things we have. So it's a little tribute to all of you.
We've got a good team on this
Thank you.
town. Yes, we do. Well, have a good evening, and thank you very much.
Okay. Now we are on to news affecting the budget. Any?
Just like that
Like that.
Did you get it faster?
Did I hear a none? Okay, moving on.
No changes from.
No changes? There any information out of Boston as to what they think's going to happen?
I'm sure we'll get a lot after this weekend. The MMA conference is happening.
Oh,
Managers
yes.
attending and other stuff. So maybe next week. Stay
Okay.
tuned.
All right. Well, committee and liaison reports.
Well,
Okay.
since our last meeting, this sort, I've gone to several library budget committee meetings and a trustee meeting, and at that point, they passed the budget. But then another budget came out because the town will be appropriating an additional 1% because the guidelines changed from 2.5 to 3.5%. So last thing I saw, well, there was another iteration then of budget, and I think they're voting again on Tuesday morning, so I'll try to go to that meeting, the trustees meeting, and we'll see what happens.
Okay. But the addition was more or less to fund the insurance.
Right.
Right,
Okay.
but I think they're still looking at taking 5 or 5%, two versions, 5
Oh,
or 5
okay.
per 0.1% from the endowment. I think they're going back on that, and I think they're still looking at some reduction in staff.
Okay. They were still trying to get the money for the insurance, so
Yeah.
it makes sense that they're going to look at it again.
Yeah, but I think they're already happy with the increased appropriation.
Right.
Why not?
Any other committees? No? Oh, okay. And the regional school, I think, was last night, what's today, Tuesday night, but they postponed till next Wednesday. Then we have a 4-town meeting coming up where they'll give us some idea of what they're looking at. And the Amherst school budget will be presented Tuesday night next week to the committees, school committees. So, and they don't vote until February. So it would be interesting to see what they have. Okay, so then we're on to minutes of the previous meetings. We have them. What is the order? Dennis, you have that.
Well, let's see. We have Sharon's minutes from 10/19,
Okay.
which she sent out again. I sent you a couple of changes today. They're kind of very brief and unsubstantial, but they're still mostly like missing words or 48 hours rather than 48 inches or something like that.
Are there simple edits that we can make and
I think so.
approve tonight?
Yeah, I think one was.
Oh, 48 hours, I just missed hours in advance.
Yeah, that was one
So
of
you
them.
got, so you
And
got
then
48 inches.
Well, it says 48 in advance of meeting.
Oh, and then there was another one about you needed an at or something.
Oh, the chair suggests that at
At
a future
meeting or
meeting,
something.
we might possibly discuss the fee structure from town.
Yeah, not substantial, but
So if you could, we can move to approve of them with the few edits that.
as amended.
Pardon?
As amended.
As amended. Do I hear a motion?
Motion to approve meeting notes
Okay.
Second.
as amended.
Wait. Who
Motion,
make?
oh, can I make the motion?
No.
Oh,
I'll move it.
Okay.
I'll second.
Okay. So the motion is to accept the minutes of, what's the date?
10/19.
10/19 as amended. Any further comments? Okay, all in favor? Were we all there?
I was just gonna ask that, were we all there?
Is everyone on
Mary Lou, Tim, Janice, Son, you don't vote, do you?
No.
Yeah, we were all there.
Okay, so we can vote to approve. Okay, it's 4-0-3 absent.
What do I do with these?
Could you just make the corrections
And send it to you?
send it to me
Okay.
again, and then I'll post it?
Okay, thank you.
Thanks.
Okay, and the next set?
Those would be mine from November 16th
Oh, sorry.
Sorry?
that I sent again this week.
Okay,
Oh. Can I back up a second? Picky point, in terms of the way we produce, maybe it's not a picky point. You said minutes taken by Sharon, most of us say acting clerk. I don't know if we want to be
Oh.
consistent.
Everyone doesn't. They
What?
had-
I don't remember.
Somebody
Say
s-
something.
They say something
And we
recorder.
don't care? Okay, I didn't know if that was one of your
I don't know.
amendments.
I mean,
If it makes-
it just
That's true.
indicates who took the minutes.
Oh, I understand that.
Yeah.
But I didn't know if there was a reason why most people say acting clerk. I mean, going back,
Or
the way I did,
recorder.
when I first joined the committee, I went back and looked at old minutes, everybody used the phrase acting clerk. So,
Well,
and you didn't, because that's why it's a minor, tiny, picky point, but I just didn't know.
okay,
If
well,
we wanted to be consistent.
Well, I think it's nice to do, just, I don't know, for whatever reason, because it rotates.
Acting clerk?
yeah,
You
just
want-
put that, and that's
Yeah.
fine.
And you can,
That's-
if you put all those people's names on one line, instead of all those lines, you'll have more space at the bottom to fit those. You know what I mean?
That's just
You have
form,
a
that's
list
just,
of
yeah, formatting.
Yeah,
at
it,
this
just
that's-
point.
save you space.
That's, sorry.
If you
Okay.
needed an extra line, so as not to go over on another sheet of paper.
Sure, no, that's great.
Okay,
So, then as amended.
okay.
Okay.
Well, no, she
It's
just,
just
it's a
like-
formatting thing, it's not,
Right.
Yeah.
it's not
It's not
information that
substance.
will be misunderstood.
Yeah.
Okay, so I move that we accept Janice's minutes of
1019.
10:19,
No, that's mine.
11:16.
Oh, her.
El-
that-
11.
We voted that.
11:16.
11:16. Do I hear a second?
Second.
Second.
Okay, any comments or edits? Okay, I read them, so, and they're fine. Okay.
Okay.
Okay, then all in favor? Were we all there? Were we all at that meeting?
I think so.
Okay. It'll be 4-0, 3 absent.
Yeah, I think we're all there.
It's, yeah, you have a 7-0-0, looks like it.
Well, that's for something else.
Oh,
But
okay.
it was at that meeting, so I would just assume we're all
Okay.
there.
And Joe's minutes.
Well, I wasn't there.
No, I'm not saying that.
I'm
I have a technical question. Now, Janice puts her name, comma, acting clerk. Is that the format?
You can do
That's
either
weird.
way.
Yeah. But we-
Acting clerk, you can put.
Well, I can tell he's a stickler.
I have
He
seen
wants it,
name, comma, acting clerk.
that's what you want.
Well, I don't know what I do.
I just
I-
want
I
to
don't
know,
know. I just was noticed that that's the picky point.
It's
that's all.
okay.
I just
There are a lot of
This
people
whole
that-
format
Yeah, I
of the
know.
minutes varies from
They
person
do.
to
They sure
person.
do.
I mean, sometimes people have topic and they put all the things there. Sometimes they don't have that. They
Right.
just have lines. So long as you can, it's formatted so you can follow what we did.
Me and Janice.
I'm not
Okay.
a stickler,
Okay, fair, good.
so. The
But I
important,
wasn't at the, I wasn't at the 11:16 meeting. That wasn't your
I
question.
didn't say, no.
Oh, okay,
No.
different question.
I think everybody's at that.
Okay.
because We had
Okay.
to vote for 7 something.
and we have Joe's minutes now.
Okay, so
What
what-
date was that?
Joe.
Janice has the dates.
But we all voted for the 11
Right.
18.
Yes, we did.
Okay. Joe's. 1/9, January 9.
Okay.
Okay. Do I hear a motion?
So moved.
Second.
Second?
We were all there,
All those, I
the
guess.
4 of us anyway. We have so many meetings, I can't remember. I know I'm at all of them, but not everyone is at all of them.
I think for that, there were only 6 people at that one. Probably Anna wasn't there.
That's what I'm gonna guess.
How many?
He's not here either tonight. So I would say 4-0. Well, you would have
Oh,
stayed
yeah,
anyway.
that
because
was
he's
the
not
meeting
there
that
tonight.
followed okay, got it.
Okay. So,
That was a Tuesday meeting.
oh, that was
Wasn't that
the,
Tuesday meeting.
that was a Tuesday
Yeah,
at 4 with the manager
Right.
and what, oh, we went
And you
over
there
that.
with Paul and Sandra.
That's when
Right.
we voted the 2.5 to the 3.5.
Right,
Okay,
I think it was at 5 o'clock,
right.
right.
Yeah.
So,
So everybody was there except for.
right,
except Anna. Yeah.
okay.
So you moved?
Yes, okay, Janice
I give
moves.
approval.
Second.
Okay, okay. Any comments or corrections?
He sent another version today.
right,
So,
okay,
just
okay,
fine with me.
all right. All in favor? 403. Those are done now. I did check on the 6:30, and Anurag has late classes sometimes that is not a good time for him, so we will stick with the 7 for our meeting time. So, okay, nothing else then? Yes.
Tim, how did Tim know that he was doing the community service?
Oh,
Did
I
you
sent
send
you an
something around?
email today.
okay.
No,
The last 2 years, we each take a section
Yeah.
to write up, and the last several years I did community service. So I was,
But
I
you
was
sent
assuming-
something around today?
well, yes, I'm glad you brought that up. I sent it around what we all did last year,
Okay.
and Steve Braun did conservation, and I can't remember the other one now. So what I put in the email is if you wanted conservation and, DPW.
Okay.
Conservation DPW. Interesting combination, right? But they share equipment, so that's good. So if you wanted to keep it, that was fine. If you didn't want it, somebody else wanted to swap, that was okay too. And I just said, let me know.
I'm fine with that.
Oh, okay, then we'll stay with what we are, and then generally you just, like Tim was doing community services, so this was great for him tonight to take those minutes and have that.
The only comment I would make about DPW is Joe is our contact with DPW.
Correct, but he also does police and fire,
Oh,
so,
okay.
if he
Well, I
wants,
think you're right. I think he should do police, fire, and DPW, and I'll do the
Do
conservation.
nothing, right?
I'll do conservation.
Conservation, that's good.
You sent something around to all of us today?
yes, I just, late in the day, I just said, these
Oh, I
are
didn't see
the,
I don't think I
I
saw
didn't see
that.
it.
well, maybe it wound up in my draft. I was having trouble with my computer. So you have the library, we all have what we had, and the only thing open was what Steve did last year. So that's when I said, if Sharon wants it, fine. If she didn't, then she could swap with someone if they didn't. So that's where we are, and then we follow. And last year, I don't know if you or Deborah sent out the Finance Committee report, the final copy. And then we look at those articles, how we wrote them up
Deborah.
in the manager's office.
Oh, no, I did.
Oh, you did, okay. So that, if we could have that again, then we just, basically use that as our template and change numbers. Of course, there are going to be articles that are new, but even looking at some of the old articles that are similar, you get an idea of how to write it up. And then once they're written, and we can start early as you go over them, and we can fill in the vote later, then I get them and send them to Janice, and then Sonia gets them too, even maybe at the same time Janice does, to fill in or check numbers, or some of the zoning, whatever their code is. So we do that, and then once we do that, then Maria Rocca, Sonia sends it to her, and since it's all done in Word, and I don't know what font.
It's Excel and Word. It depends. I must be asleep already.
The font?
All of the text gets done in Word, but all the charts get done in Excel.
All right, we don't do the charts.
We can't change a chart in
No, you
everything.
can't.
No, that's all.
Just
That's
so you
all.
don't try.
And we don't even have to
Oh, I
do.
never tried.
No, we don't have to develop the charts. We just do the text, and so. But we need to check our numbers in that, and then we usually do it in Word. I don't know what font and what size, and then we do it the same, and then they can make changes rapidly, and Maria takes them and then assembles it all, and then we do a couple of times. We do proofing of the final copy. So there's a lot of work in it, but knowing ahead of time what you're going to do, you can look at what we did last year and begin to think about it for this year. What I'm trying to avoid is kind of the last minute. This is the last weekend. We have to get this done, and then we push town staff, which we shouldn't have to do that. We should kind of fit it into their schedules. So yes,
Is town meeting starting April 30th?
yes,
Is that right? Because I had written down.
right. I know. I had the
somewhere.
dates. I gave you Wednesday the 30th.
No, I know, and I know you said the 30th, but I had in my calendar the 23rd. So I didn't know where that came from.
I don't either, but I could have written it as you two are not
I didn't
saying
know.
it.
It could be, it could have been changed. That might have been just a preliminary number. I don't know, but it is the 30th.
Monday the 3rd.
Right. And then we will
Not bad
be
for a dumb phone.
we will be getting something.
A dumb
The select board is going to be doing warrants after we make some
scored perfect score on the
recommendations.
cognitive test.
But the final warrant basically is, or the final meeting with council really looks at the wording of the language to make sure it's legal. Right? We don't
Somebody
really.
actually puts together.
It really doesn't impact our votes or what we've talked about or what we're doing.
Spreadsheet.
For the
Our
final,
vote.
yes, for the final reading
All
by the
initials
lawyer, which
next
is
to
late in
ones we're
April.
dealing with,
Right.
By the time
spaces
we
for
have
words
everything
that we
in.
use file.
Right
Yeah,
in
the
March.
book will be done by then, the motions don't go into the,
Okay, no, the motions don't. So, okay. Do I hear, unless.
There are no other topics not reasonably anticipated, correct?
No, I have
Okay.
none. The next meeting will be next week, and it will be general government, and the manager is coming.
I believe so.
Okay. Then there we are.
If not,
I
I
guess.
guess.
I know, but I thought we moved it because he wanted to be here.
I don't know.
Oh, okay.
So I guess Analog takes minutes if he's.
Well, he
there.
has he has about
Sharon.
three weeks in a row of minutes
Well.
because we've gone over
we just-
them once. No, but he has to.
I think we'll be here next week, but if not, Sharon's next, just for your information.
Okay, and you will have general
Oh
government.
my goodness.
Well,
Okay.
that's next
I
week, we don't
think
know if
we'd
she'll
be
have
out
it
of
or
here
not.
like really here.
Okay, do I hear a motion to adjourn?
Oh, so moved. No,
Second.
9:57.
Yeah, we
All in
spent an hour
favor?
with the health department.
Wait, what?
Spent an hour with the health department budget.
Because it was the first one.
All right, you can turn us off.
Probably.
Okay, adjourned.
That's it. We're adjourned. Oh, yes.
When is?
We adjourned
the
at
next-
same time we came in.
9:57.
9:57.
Cause I didn't have it.
You did not.
Yeah, this.